All right, Trustee Carpenter.
I would agree. I think understanding the board's sentiment first may help the public's sort of tailor their comments for what we're thinking, because I hate to be repetitive and to, you know, if we're all in agreement on one thing that, that we, you know, belabor a particular point.
Okay, so could we have Rebecca review the proposed ordinance?
I'm going to actually have Attorney Bayer do that. Trustee
Okay.
Stokebrand, I was not involved in the drafting of the
Okay,
ordinance.
thank you. And then we'll go around the table and get feedback on that, if that's okay with everyone. Thank you.
Good evening. Can everyone hear me okay? Can everyone hear me? Excellent. Okay. A couple of comments. As everyone may know, this came together relatively quickly. There was an item for future consideration on Monday evening's regular board meeting agenda. And based on the urgency of the situation, the board decided to have a special meeting this evening to discuss this further and look at a regulation relating to face masks within the village of Shorewood. As a launching point, I was asked to take the item that our neighbor in Milwaukee is considering, their ordinance as a template, if you will, and as the village attorney see where that would fit if we were going to do an ordinance versus a resolution, and see where that ordinance would fit within the existing structure of the Shorewood Village Code, which I did, and then I added all of the other provisions that we generally put in there to essentially make the document legal. But I want to stress that the purpose for doing that yesterday, I was asked to do that yesterday morning quickly so that we could get something in the packet as a launching off point and a discussion point. What's in there though, it is not necessarily an endorsement of every single subpoint that our neighbor our neighbor Milwaukee is evaluating as a potential ordinance. And it's certainly not an endorsement of me personally in terms of the science side of it. That's what we have the North Shore Health Department here through Ann Christensen to address this evening. I'll give you a couple specific examples. For example, there's a 30-foot requirement in the Milwaukee prospective ordinance relating to contact between individuals outdoors. As the village attorney, I have no idea whether that's adequate, inadequate, or overkill, or none of the above, or all of the above. I don't endorse one way or the other. But again, the purpose and intent was to take something that our neighbor community had started as a launching off point for a discussion. So I think the purpose and intent tonight was to come together as a group and lean on the expertise of the North Shore Health Department. Ann Christensen and I had a discussion this afternoon about some finer points related to things like enforcement and parameters, and what the impact of the state Supreme Court's decision striking down the statewide shelter-in-place order had been. So we'll listen to Ann tonight on some of the finer points of the science behind this. And then the idea was that general framework from Milwaukee, though, does address a number of different things: indoors, outdoors, public spaces, and all those kinds of things. So we can use that as a framework and then come together as a village, Shorewood, tonight to discuss what works within our little 1.5 square of Wisconsin, and use that to figure out where we need to go. So that, again, there's the inclusion in the packet doesn't necessarily mean that anyone is wedded to those ideas, or that is what someone has stuck in their head as this is absolutely the way Shorewood needed to do it. It's just that we had a turnaround time of less than 48 hours, and we needed sort of a starting or a launching point. So that's what we're here for tonight. So thank you for your time.
Okay, could we next hear from Ann Christensen, please?
I'm sorry, point of parliamentary procedure here, or I guess point of order. Chairwoman Stokebrand, so I would also like to interject that I work at City Hall in Milwaukee, and the ordinance example that was used was the preliminary draft that was provided by Alderwoman Dimitrievec. It's since then changed. It's gone through repeated revisions based on the city attorney and assistant city attorney's input, and it's a lot more concise, and a lot of things have been removed or changed, including, like you said, the 30-foot, including the age of the children, etc. So I would just ask for a little clarification from this group. A couple of things. One, I'd like to know how long we are planning on spending on this discussion this evening, what our objectives are out of this evening. And then from there, just realizing, Ms. Stokebrand, I understand you're new to the board, but we do have a lot of people that do want to speak, as well as the trustees. And I do want to hear what Ms. Christensen has to say, but I don't know, I do want to have a little bit of framework around this discussion tonight, just given that this is probably, you know, it's a big deal, and there's a lot. So thank you for that.
Thank you, Trustee Bockhorst. So again, I'm going to ask for Ann Christensen to please give us some background here. And then
Sure.
I thought we'd go around the table and the trustees can say what they're thinking. And then I think we'll probably open up for discussion and consideration, if that's okay with everyone. And then Tammy, Trustee Bockhorst, you can provide your input about the city updates when we go around the table, if that works for you.
All right. I'll start in terms of a couple of points. So the North Shore Health Department is very supportive of Shorewood moving forward with an ordinance for face coverings. We have in our guideline document the recommendation that the public wear cloth face coverings when they're indoors and not otherwise able to be within 6 feet of somebody. So this would be in line, or at least the process of discussing this would be in line with those guidelines. There's a couple of, I think, concerns and issues that were raised that we also have in terms of the ordinance from the city of Milwaukee, and would find it best to align with their ordinance for consistency across the region. So I have not seen their updated ordinance and would find that helpful. In terms of some of the specificity about 30 feet, I am not sure of their science behind why they chose 30 feet in terms of the definition of close contact, and what our concerns have always been is that 6 foot distance between people. And that's where the North Shore Health Department would fall on in terms of this distance, and as well as the science. If the city of Milwaukee has other science about why they came up with 30 feet, I would certainly be willing to hear that. But again, all of the recommendations have been to be outside of a 6 foot distance threshold for close contact. And then the other issue that has been brought to note is the people under the age of 2. And obviously, you know, children have a lot of different challenges with wearing masks. We have followed the guidelines and recommendations of CDC that children under 2, it is not recommended that they wear, but in terms of an age cutoff, I know the Dane County ordinance says 5 years old. Some of this will really depend on what the village of Shorewood is going to be able to find best for their citizens. Again, in terms of the public health recommendation, it's just that nobody under 2 would be required to wear, or recommended even to be wearing, a face mask. So certainly we are open to considerations for children, because we understand and recognize the practicality of children wearing masks is very complex. The other aspect of this ordinance, again, as written for the North Shore Health Department, which is very different than the city of Milwaukee's health department, is back down to that enforcement section. And it's highlighted in red for a number of reasons. One being the resources of the North Shore Health Department are tremendously different than the city of Milwaukee resources. So one of the major concerns I have with this ordinance is again, the health department being the enforcement agency for it. That is not something that we do on a day-to-day basis, is enforce ordinances for citizens. For example, when we do enforcement, it is really in partnership with other municipal departments, say this police department or the building inspections. So this would be something that would be unique for this particular ordinance, and one that I would be very concerned about our health department, which serves the 7 communities in the North Shore, being able to have the resources to carry out. Again, that doesn't mean that we're not supportive of it or wanting to find a way to have some enforcement parameters in here. But again, as it's written, I would find this very challenging for our very small health department to be able to undertake such enforcement. So those are my initial concerns with this. Again, in terms of concept, I think that an ordinance seems to be an important direction for the public, and it gives some validity to the guidelines and as well as some traction in terms of the community recognizing the importance of face coverings. Again, more and more research coming out about the importance and health benefits of wearing face coverings, both for the people around the person wearing the coverings, but also preliminary research on some benefit for the wearer of the face covering. So that science is certainly strong in that sense. So that is our position on the ordinance at this point. And I look forward to being part of the discussion about how to make this stronger and more applicable for the village of Shorewood.
So just to be clear then, the penalty part says the health department shall enforce this section, but you basically just said we can't enforce it. Is that correct?
Yeah.
So
yeah,
what
and this, again, back to Nathan's comment about this being lifted directly from the city of Milwaukee, they do have the ability and the power to enforce this type of ordinance. That is one primary difference between our health departments. And
so what would you suggest we do?
Well, that's going to be a really challenging discussion to get into because so that I don't have a good answer on because yet I'm open for discussion, and maybe that's part of what we talk about today. So you really have no answers on enforcement? Not at this time. Okay, thank you. At this point then, let's go around the table, please. Trustee Amenta?
Well, I guess I concur with Ms. Christensen in terms of the age. I think between 2 and 5, even 5, may be difficult to get kids to wear a mask or to mandate wearing a mask. And I also agree about the 31 feet is far. I think 6 feet is the number I've seen. I wonder if we, in terms of enforcement, if this is something that building inspection could take on. I don't, the only enforcement what are we really talking about in terms of enforcement? I think the way it was written is just to businesses, if businesses fail to enforce it. So we're not talking about person to person, out on the street. We're just talking about a business, correct? So, I mean, I think maybe that's a low enough number that something building inspection can take on. I guess my main concern about it is I do support absolutely that this is something that needs to happen. And I think if it doesn't happen statewide, I think it's going to happen everywhere anyhow very soon, or at least most places. But my main concern is creating issues between residents of, somebody seeing someone inside and not wearing a mask and starting something, and, issues between people, and then feeling like, oh, I'm going to call the police or call whoever's enforcing this. And I don't know that that's a healthy dynamic or something that we want to get into. So that's my main concern about it. But generally speaking, I think this is something that has to be done, and I support it.
And I'm going to apologize here. I think I should have gone to Chief Nimmer before I went to the board, because I'd like to hear his thoughts on enforcement, please.
I'm sorry, point of parliamentary procedure, Kathy Stokebrand. One of the things that I would say is that are we going in sequential order, or are we going to enforcement because this was the issue that the health department brought up? I would just ask that we try to make sure that we give people the opportunity to speak, and then perhaps it will go from there, that we'll each have questions. Again, I just want to make sure this meeting is run in the most fair and dynamic way as possible.
It was my mistake, Trustee Bockhorst. I meant to get staff reports first, and I forgot to get Chief Nimmer. So if it's okay with you, we'll go back to him, and then I'll continue with you, if that's okay.
Does he have a staff report, or is that why? Or I'm just curious why.
I would think he would have some input. Chief Nimmer, please.
Yes, I'll I'll defer to the enforcement piece until we get to that point, and then I can discuss some of the challenges and some of the things that we could or could not do, if that's okay.
Okay, Trustee Bockhorst, please.
Oh, thank you. So again, kind of not knowing how we're going to go about this, I'll just start it. I would prefer to simplify this versus elongate, but I'm almost thinking at this point, I know that Trustee Amenta wanted to hear from board members first, but I don't really think we have an example of an ordinance that, like I said before, this sample ordinance that we got from the city of Milwaukee, this was not from the entire board. Their common council has yet to even discuss this as a council and go through it. So this is a draft that was provided to the common council by one member, the draft that we all have here. Since then it's been revised considerably. And still the first meeting discussion amongst council members will be tomorrow at 2:30 in the afternoon. And you can watch it on Public Access Channel 25. And then there is a special board meeting of the Common Council the following week in order to potentially consider this. So just so everyone here knows, everyone, that this ordinance sample that we have, like I said, was never fully discussed by the entire, or even more than one person that I know about. I'm not saying it's a bad ordinance or not, but so much has then changed, and input from other members, including the health department, legal, etc. So I think that a prudent thing for us to do as a board, instead of picking through like and saying if we're going to do X, Y, or Z, because again, what we have in front of us looks drastically different from what Milwaukee even has in front of them for their discussion tomorrow, is to think about from a higher standpoint, what are we trying to achieve? Do we want to take on all aspects tonight, or do we want to focus on indoor use? Do you want to talk about public places or places of public accommodation? Or do we even want to go to something along the lines of places where public structures or premise are licensed by the village of Shorewood? Because then we would have some kind of means for oversight and you know, other things like that. So that's why I know there are a lot of people that are very passionate about this on both sides here this evening, and I look forward to speaking or hearing from them. But I do think that we do need a little bit of structure around where this is going tonight, because if you were to ask me if I wanted to pass this ordinance that we have in front of us tonight, absolutely not, for the reasons I just stated. It's not, you know, it's been, a lot has been changed and dissected. So I would think that we would want to come to agreement on a few things this evening as far as the board is concerned, what our objectives are, and we don't have to do that at the beginning of this meeting. But if we are going to just go through this ordinance, this would be an exercise almost in futility.
I think we were just looking for an overview, perhaps regarding the ages and the distances and indoor versus outdoor. Did you want to tell me anything about how you felt about that right now, or should I move on to Trustee Carpenter?
Well, what I want to tell you about that right now is, okay, I'm going to step back. I support doing something, even though we can't probably do the perfect thing. That shouldn't preclude us from at least doing something that's in the public interest this evening. We have a lot, this pandemic has been going on. This is the first time at the board level that we've had a serious discussion about regulating this. And I'm happy, and it's long overdue, and I'm glad we're doing that. We need to show our leadership and that we care, and that, you know, that those that are working and playing and participating in Shorewood also understand where the village is coming from. For that, I believe that we do need to hear from residents to hear what is important to them. And then perhaps we could, so I kind of think that we're doing this the flip route. Instead of listening to those that have the concerns, I'm not sure why we are framing something that discusses all the details. And I also want to prevent us from designing by committee this evening. Again, if we have the general overarching criteria that we give to our attorney or whoever would be writing this, that would be a lot more beneficial than all of us going around deciding which age we think is appropriate, because I don't believe any of us are actually the experts on that. But what we are, the representatives are the participants and the people in this village and what their needs and such are. So to me, again, that would be very important to hear. Not only, and also, you know, whether it's staff, and I appreciate that that Ann Christensen gave us that information. Thank you very much. And I would, and Ann, from you, I wouldn't mind even hearing, you know, what you think the bare bones of the ordinance should be. I'm not saying who should enforce or, you know, the details, but the general, the big picture stuff. And then the devil's in the details, we can let the attorneys deal with that.
Okay, if you're finished, Trustee Bockhorst, I'll move to Trustee Carpenter, please.
Thank you. Can you hear me? Okay. I did work on this with Ann Christensen and with Attorney Bear. We did take the some of the language from the city of Milwaukee, but we did work together to make some points that were a little bit more pertinent. And we did sort of just try to get something together so that we as a board could have a place to start this conversation. I understand that it's a little bit different than what Milwaukee has now, but I think that for us as a village, this is our starting point and we need to move forward. The things that I think are important, I have a 4-year-old. I will say I think 4 needs to be that cutoff age, because if we are going to send 4-year-olds into K4 in the fall, they need to be wearing masks. I appreciate that, you know, 2 and under, I think that that makes perfect sense with CDC guidelines, but I do think 4 is a more realistic age. And for that reason, I personally would like to see it in all public buildings. And I would like to see it in all buildings that are open to the public. So businesses, as well as schools, anything that is open to the general public. I think the enforcement piece, there are multiple businesses who have reached out, who have said that they just need something to say to customers, you can't come in our building without a mask. This is required by the Village of Shorewood. So while I understand and I definitely echo those concerns from the health department, I do think that this is I do think that this is something that is going to be manageable. And if it isn't, I think we can come back to the drawing board and go from there. Let me just make sure I'm not forgetting any of my other thoughts. Oh, the 30 feet. I do think the 30 feet as well is excessive. I do think about for outside. Personally, I like to run, and I think being able to run and being able to be outside and remain 6 feet away from another person is realistic. So I do think the 30 feet parameters outside is excessive. So those are sort of the big things that I would like to modify and change in the current document. And I would also like to hear from residents. We've had a large outpouring just to the village board of support for this. And, you know, I do want to hear from the residents as well, but I do think that it's important to hear what everybody on the board is thinking, so we have some consensus. Thank you.
Oh, thank you, Trustee Carpenter. Trustee Ursink, I'm just going alphabetically here.
Thank you, Trustee Stokebrand. And, you know, I do think that this is long overdue. I'm fully in support of a mask ordinance or mandate in Shorewood. I think for the productivity of tonight, if we were to focus on indoors and what that looks like, would probably serve us best to focus on one sector. You know, and also, you know, with kids and distancing, I agree with everybody. I think 6 feet is more reasonable than 30 feet. I don't think, you know, we live in Shorewood. I don't think we could all distance 30 feet and still stay in the community together. So I think 6 feet is probably reasonable. I'd love to hear more about the science with kids, behind kids. And at some point, if we could talk about kids, and I know there's some doctors, I'd really love to like hear from the community and hear from some of the physicians in the community, whether it be five. I know that with our work with Shorewood Little League, we've been mandating our own, kids to wear masks, and it's been working great. These kids are all generally 8 and above, and it can be challenging with 8-year-olds to wear a mask. I can only imagine a 5-year-old wearing a mask, and how difficult that is going to be to accomplish. With that said, I'm for it. I'd love to listen to the experts. I'd love to listen to all the experts on the call just to kind of get a better sense of the science behind it. But I'm here to listen to everybody. So I would say, love to focus on the indoor aspects of this policy. Would love to focus on, would love to keep it 6 feet, and then I'll keep an open mind for for kids wearing masks.
Okay, and I'm next. I favor an indoor mask mandate for places that the public would be going. Don't see any need to do the 30 feet. I just don't see an outdoor need at all. And I was going to say age 5, but I understand Trustee Carpenter's K4 concern. And my concerns are enforcement. And, we've heard from some grocers, the grocer, about enforcing it. And so that's the $64 question to me, is enforceability. I suppose you could make it a recommendation, but without the teeth of enforcement, I don't understand how this works. Trustee Warren.
Can you hear me? So the joys of having a last name that begins with a W. I am last. So the very first thing I wanted to do is thank you to our residents. Thank you for your feedback. I've checked email periodically throughout the day, and rest assured your voices have been heard. I'd also like to thank you for taking this time out on your Wednesday evenings to join us and to express your opinions here. We very much appreciate hearing from you as we try to do something that's really at the vanguard here in Wisconsin. So I guess I'll start by saying that I support the ordinance with the sense of urgency here. I think this discussion is appropriate on a day when the U.S. sadly has passed 3 million cases of coronavirus. And projections now show, in fact, in the article that I was reading, that the wearing of masks can reduce the amount of deaths that will occur due to coronavirus by the tens of thousands. So I hope that this is something that that becomes commonplace, as it is throughout the United States. And I hope that other municipalities on the North Shore and around Wisconsin follow the lead that we're establishing here tonight. As I read through some of the documentation provided to us tonight, I think there are some unanswered questions. And I'll go with my questions, and then I'll circle back to the text of the ordinance. The 2 questions I had, which I think we can talk through later on tonight, are if we do pass this tonight, what kind of communication plan will we have? How will we outreach to residents? When is an effective date? I think that it's important we get this in place as soon as we can, but I also recognize that there is an adjustment period, and we need to communicate to our residents what's expected of them and to our businesses as well. The other thing that I thought about was the equity concern. We want to make sure that people have access to masks. I would like to see, if we pass this ordinance, some way for Village Hall to supply our residents with masks if they do not have access to masks. As for the specific text of the ordinance itself, I agree with my fellow board members. Raising the age to 4 or 5 seems right to me. The outside, if we get to the outside piece tonight, I think the distance, going down even 6 feet, I would be fine with. As for the enforcement piece, that looks like it's going to be the sticky part here tonight. And I would encourage, and the way I'm going to think about it is being agile. It's something where I would imagine we'll end up with complaint-based enforcement. So hopefully it's something that different departments will have the capacity to take on. And frankly, given the urgency here, it might be something where if we do something and it doesn't work, well, we might have to pivot quickly. We can always call another meeting. This doesn't need to be the final draft of what we're doing if we feel like there's something that we can do better. Also, it might be something where we need to put something in as a placeholder tonight and improve it and look at it and talk to stakeholders and come back with something next week or our next village board meeting. But I think agility here is going to be key as we have this discussion, because again, this is something that I feel a general support for and I see as an urgent pressing need. Thank you.
Okay, thank you. Are we ready then to open this up for, did no one had a question for staff then from the board? Does anyone, we can start with public comment, or is anyone prepared to make a motion? Why don't we open it up to public comment then? Sarah, you had a list of people. Let's start with your list, please.
I do. I do have a couple, Jennifer and Brady McIntosh, who would like to do a brief presentation if everyone's comfortable with that. I'm happy to share my screen and unmute them. Hold on 1 second.
Thank you, we're here.
Oh, perfect. Let me share my screen and
So you'll project the slides for us?
correct.
Okay, so we'll just say next slide when we're ready to move on.
All right, there you go.
Great, thanks very much. I really appreciate you guys giving us the opportunity to speak. I'm Brady McIntosh. I'm an emergency physician. I work at Frederick Hospital. I've been in practice for the past 10 years, and I've helped to develop hospital-wide policies to deal with patients that are suffering from COVID-19. And my wife, Jennifer, is a high-risk obstetrician. She deals with very sick pregnant patients and complicated pregnant patients, and has been published with national guidelines regarding how to manage pregnant patients with COVID-19. So this is a problem that we're very intimately familiar with. We see these patients every time we go to work, and we understand the pressing issue of this pandemic on our community. And I also want to thank the board for meeting so quickly, because as has been stated a couple of times, this is an absolutely urgent issue that we need to get ahead of and manage proactively instead of trying to react to overwhelming infection. And I appreciate you being so agile and willing to meet urgently like this. Next slide, please. So as we've seen over the past several weeks now, that's going to go away anytime soon. Our initial public health strategy of social distancing to attempt to flatten the curve and slow the spread to give our hospitals time to prepare and our government time to handle the problem from a more public health standpoint was not used wisely. And we are back in the same position, if not a worse position than we were at the beginning of the pandemic. We don't have the public health capacity or citizen buy-in on a national level to deal with this problem, but that is something that we as a community can take on ourselves. So our national leaders have abdicated this responsibility, and it's on us now as a smaller community to protect our citizens and take on this problem. With a vaccine, an effective and well-studied and safe vaccine, unlikely to become available for the next 6 to 12 months, it's going to take us even more time to deal with this problem as our Wisconsin daily case counts continue to rise, or at the very best stay stagnant and not get better. Next slide, please. You know, as I'm sure we all recognize, protecting our citizens, our fellow citizens, is extremely important, especially our most vulnerable citizens, the elderly patient or the elderly citizens that are around us, the immunocompromised, and essential workers, and hopefully and eventually teachers need to be protected from getting this disease. And as you can see from some of the data on the right, this is a disease that disproportionately affects elderly patients with chronic health conditions, but it doesn't spare young people. And if you don't know someone who is young and healthy that has been affected by this disease and affected in a serious way, you will. And we see patients like this in the emergency department all the time, who come in, who are young and healthy, who have severe difficulty breathing and chest pain and need to be hospitalized for this disease. So this isn't a disease that is strictly for the elderly and immunocompromised. And even if it was, it's still something that we have to be very vigilant about and protect those citizens among us. Next slide, please. So briefly want to talk about the efficacy of masks. As you can see on these graphics, The transmission of COVID-19 is currently thought to be through droplets, and masks are very effective at reducing droplet transmission. The scariest thing about this disease, as I'm sure we all know, is that you can have it and not have symptoms for up to 10 days. So it's not something where you develop a fever, you develop muscle aches, you lose your sense of taste and smell, and you isolate yourself in a room and you're good for not worrying about infecting other people. We all could be walking around with it right now and not know it and not develop symptoms until 10 days after we've become infected, or go through the whole course of the disease without developing symptoms. So it's important for all of us to adopt this strategy of reducing transmission via face mask wearing. Next slide, please. Recent data has been really good in showing us that overall infectivity rates are decreased by public health mandates in terms of wearing masks and buy-in from the public in wearing masks. 172 studies were collated in the Lancet Journal recently across 16 countries and 6 continents that showed that transmission decreased with physical distancing over 1 meter or 3.3 feet. And that transmission decreased further the further away that you stood. And I know there's been a lot of discussion about the exact numbers on how far away to try to distance yourself from people. 6 feet is a number that's been thrown out in the media throughout this pandemic, and I think it's a number that everyone's comfortable with and understands and knows. And I think that's a very reasonable distance to try to maintain. And also, their quote from the article was, face mask use resulted in a large reduction in the risk of infection, and you can see that as a graphic on the right side of the screen there. Next slide, please. So the next question we want to address is whether these mandates really work. You know, it doesn't make a whole lot of sense, or it's not a really good use of our time to sit here and talk about this and have a big discussion about it if people aren't actually going to wear the masks. And we can see some data here that shows that these public health mandates do work, that once it becomes more common knowledge and people are more comfortable with it, they are more apt to buy in and more apt to actually comply with these resolutions than if there's no mandate in place at all. Next slide, please. And this is another graphic that shows not only does the compliance with wearing masks in public improve with mandates, but also the overall health outcomes improve as mandates are enacted too. You can see the transmissibility of the disease, the morbidity and mortality of people coming into the emergency department and being hospitalized improves as mandates are put in place and as more of our citizens wear masks in public. Next slide, please. And lastly, you know, we all recognize that it's really important to protect our citizens and to try to keep people healthy. But the other issues that are really important to everyone in our community, and we recognize this wholeheartedly as the parents of a 4-year-old and an 8-year-old, are that people want schools and businesses to reopen. And we are very understanding of those concerns, and we share those concerns. The best way to get our schools reopened and to reopen our businesses is to reduce the rate of infectivity in our community. No one's going to want to go to your store. No one's going to want to go to school if we have an incidence rate that's prohibitively high. And the way to decrease that incidence rate is to make a public mandate to wear a face covering, both in public places outdoors, public places indoors, and private businesses. The other thing that's really important for getting children back to school specifically is to make mask wearing commonplace and to make them comfortable with it. You know, our children follow our example. We're going to need to have a mask mandate if we want to reopen schools. So if we want to make them more comfortable with wearing masks and having them on in public, we need to model that behavior for them. Our children wear masks in public. They do it with very little complaint. Every once in a while, there's a little bit of whining about it. But they do it and they're comfortable with it because we've made it normal for them. And we've told them that it's important for them to look out for their fellow citizens and to look out for other children, and especially, you know, their grandparents and the other people that are on our street. And they embrace that responsibility and they follow our example. So if we make this commonplace, if we show our children that it's okay and it's normal to wear masks in public because you're looking out for other people and you want them to be safe and healthy, they will follow our example. I think that's all that I had to say. Did you have anything to add, Jen?
No, I think that primarily covers all the key points. I think that we were hearing from the board before we started speaking, the questions on the distancing, and Brady mentioned that 6 feet seems to be reasonable for us all to adhere to for masks. And then I think secondly, I know there was some quibbling of should it be just indoor, but I think any day you walk by Atwater Beach, you can see that people are less than 6 feet away, congregating in groups that are certainly not their family members. So I think a mandate for public spaces is important if you're not 6 feet apart. So I think it needs to be more than just public property. I think it needs to be indoor and outdoor and private businesses as well. We understand that the enforcement issue is going to be tricky, but as board member Warren mentioned, you know, we can start with the mandate and see what issues we're having with enforcement. And if you have to come back to the drawing board to figure out whether there needs to be penalties and fines, then you figure that piece out later. Hopefully just a mandate and reminders will work to make this a normal part of everyday life in our community. I know that there's at least one pediatrician on this call that can speak to the masking as it relates to children. Hopefully she'll raise her hand and speak next or soon. But Children's Hospital requires anyone entering their buildings greater than age 2 to wear a mask. So I know people were quibbling on whether less than 8, less than 4. I think we as parents of a 4-year-old can say that 4-year-old can wear masks with confidence and appropriate education and modeling.
And one more thing to add quickly, we're both more than willing to stay and answer any questions from trustees or from the public throughout this call. So please do ask any questions of us if you feel like that's appropriate and you have any information that you want us to share. Thank you again for allowing us this time.
Thank you so much. The next person in queue is Lance Weinhardt. Lance, if you could unmute yourself and give your name and address.
Sure. Hi, this is Lance Weinhardt, 4037 North Stowell Avenue. I was on the last call, and I should mention I'm a professor of public health at the University of Wisconsin-Milwaukee School of Public Health. And based on the science so nicely laid out by Doctors McIntosh, I would, I'm fully in support of indoor and outdoor masking regulations for Shorewood, and agree that it's urgent and incredibly serious right now at this state of the pandemic. I guess 3 things I would like to address. One is that I've seen some conversation about how can we be certain that this is the right thing right now? And, things have changed and people have used to say it wasn't important, but this is the way that science works. And this is a new epidemic. This is a new virus, and we've learned a lot about it. The science that was just presented to you showed, 170 studies done on prevention of transmission and the meta-analysis of those and showing the impact of masking. And so now that it's irrefutable beyond a doubt, we know that this is important, and we didn't know that at first. So it is normal in science for things like that to change as we learn more about it, especially with something as new as this. Secondly, I want to add that around the enforcement issue, I agree with some of the trustees who mentioned that, a lot of folks just need something to fall back on to tell people you need to wear a mask to come in here. And the village making a regulation about this is going to give them that support for them to enforce it themselves. And part of that process is also changing the social norm. As you saw in the graphs that were just presented, over time, the compliance goes up, as part of that is people seeing other people complying and wearing masks and realizing, hey, this is what we need to do to protect our community. So gradually we change social norms, but if we don't have a strong statement to begin with, or that regulation for the community to start with, that does jumpstart the whole process, and it is really important. And then thirdly, I want to read a letter to you from a business owner in town that gave me permission to share this with you in the public meeting here. It may have been shared with the trustees directly, but I have heard some comment about we need to see what the business owners think about this, and hopefully you've heard from others, but this is from the owners of Cloud Red, Rebecca Lowen and Liz Duggan, and I'm just going to read it and not paraphrase, but to whom it may concern, out of precaution for the health of our staff and customers, we have chosen to remain closed for inside dining at this time. We currently provide carry-out services and have recently opened up some spaced out tables out front. We follow CDC and North Shore Health Department safety guidelines, including, among others, implementing a requirement that employees wear masks. We also require customers to wear one if they want to use our bathroom, the only time customers are allowed inside. We do not want our neighborhood, city, county, state to become the next hotspot. And as such, in order for us all to remain open safely, we would support a uniform mask ordinance when inside public spaces or when social distancing measures are difficult to maintain. Otherwise, many of us may risk having to close down again if current trends continue. Thank you, the owners. So again, I share that with their permission. And I guess one last thing I wanted to share that I have collaborated with a group of people recently to help kind of spread the word about the importance of masks. And we sent a draft resolution to the village trustees that contains some language that you might also want to consider as you get into this a little deeper. Again, there's, people are working on these and they are kind of living documents as we learn a little more about the science. But one issue is, I think, restaurants and indoor dining, and how can people wear masks while eating or drinking indoors. And so that ordinance, the order that I brought that language from, that's already been passed in a different state, this is a done deal in other places, contains, I added some language about how that can work inside restaurants where to reduce risk, keeping the mask on when not actively eating or drinking, and replacing the mask when not actively eating or drinking, to protect the other patrons and the staff. So you might want to look at that language and consider adding that. I think that could help us become, even that much more safe as a community and for the businesses. So that's it. Thank you.
Thank you so much, Lance. Next, I have Sheila Long. Sheila, if you could unmute yourself and give your name and address, please.
Yes, hello, this is Sheila Long. I run Malamado. It's a co-working community for women on Oakland Avenue. My address is 4515 North Marlboro in Shorewood. I support the 6 feet distancing. It's very hard with the pandemic having impacted business when there are no rules in place. When people come in for tours, when you finally get someone to come in for a tour, and then you have to tell them to put on a mask, and they don't want to put on a mask. So if there was like an ordinance, it would make it a lot easier. And but if somebody is sitting in an office by themselves with a door shut, I don't think that they need to wear the mask. But if they're walking in a common area, then I would support that. So that's all I really wanted to comment on, but thank you for all of your work.
Thank you, Sheila. Next, I have Liz Nelson. Liz, if you could unmute yourself and provide your name and address, please.
Hi, this is Liz Nelson, 1905 East Jarvis Street. First of all, I can't believe I'm only the 3rd one who contacted you, Sarah. First of all, I'd like to thank the board for calling quickly for this meeting. Time is running out. In fact, I actually feel that it has run out. I'm in favor of a mask requirement for both indoors and outdoors. I've spent the last 4 months in my home. I have a view of the street and I get out when I can, but I don't feel safe when I'm outside. I wear my mask, I distance, but others don't. And so we need a consistent message that we're sending to the village. In July of 2009, the village enacted a village-wide ban on smoking. So there's precedent for us being forward-thinking in initiatives when the health of the citizens is involved. And there was some initial pushback, and this was before the state of Wisconsin. It was a whole year later that the state of Wisconsin had a ban on smoking both in public and private spaces. So we were pretty progressive in regard to that. And the main reason that that was implemented was because we cared about the health of our citizens in Shorewood. And what we found was that people did in fact start coming more to the restaurants and bars, and we saw that statewide. I've never lived during a pandemic. I want to make it through this pandemic. I'm 62 years old. I'm in a borderline high risk, not so much on my age, but an autoimmune issue that I have. Couple things that come to mind is because we have had zero leadership on the national level, and in fact, this whole pandemic has been become a very divisive issue. It makes it really hard for people. I get that people are really struggling to understand. I thank the doctors for laying out in a PowerPoint presentation the facts. I'm a science believer. I'm the my grandfather was a doctor. And so I believe in the science. This is not a hoax, but I think Shorewood can take the leadership. I have a couple friends who are teachers and are really concerned about returning to the classrooms. My kids are grown, but I would be terrified as a parent. The other thing that I would mention is that it's true, our kids do model what we do as adults. So when it was time for my kids to ride their bikes and we went riding, everybody wore a helmet. I wore the helmet, they wore the helmet. Same with seat belts. It was a discomfort, but it was something that we got used to. So I think it's something not that we should do, but that we have to do. And I think you all can make that decision. And it's going to be uncomfortable, but I do think that we have the ability to be leaders in this. And we do have the ability to set up and implement education programs for people so that we can move forward with that. And, you know, masks are available. There are entrepreneurs in Shorewood who are making masks and we can support them. I like the idea of the village supplying masks. I'd like to see if this is passed that Metro Market, like Outpost, has masks available for customers who don't have them. I want to be able to walk and feel safe outside. I just want to kind of wrap up with a couple things. And one is that I have saved 3 lives in my life. One life that I saved required training as a certified lifeguard. The other 2 required intuition and phone calls. I think that we can, to save each other's lives, we can wear masks and get used to it. And here's a quote. Please tell me my life is worth a little of your discomfort. Amy Arlen, an ICU nurse in Fresno, California, and she just wrote that this week. I think we can do this, Shorewood. We need to do this, and I want us to be the leaders in the forefront on this. Thank you.
Thank you, Liz. The next person I have on the list, and please forgive me if I'm getting this incorrect, is Hong Debu. If you are on the call, if you could unmute yourself and say your name and address, please.
And I'm sorry to interrupt, point of parliamentary procedure. I noticed there are a lot of people that don't have their mics muted and I'm hearing a little bit of feedback. So perhaps we could ask everyone to mute themselves and then remember to unmute and mute yourself again.
And can I also make a point of procedure? If everybody could just use their names. I know everybody's got comments to make with the names, how they're naming themselves. We appreciate it if you could just use your real name. You know, that would be very helpful.
All right.
Okay, Sarah, do you want to go ahead then? Thank you, Trustee Erstink and Trustee Bockhorst.
Hello, hi, I'm Hoong Ding Vu. I guess I'm the next speaker.
Yes, thank you.
Yes. I'm a practicing primary care physician in town and a Shorewood resident for the last 24 years. I wholeheartedly support a masking requirement for the village. I think it should be required in all indoor public spaces where the transmission of the virus is much more likely to occur than out of doors. As individuals, wearing a mask along with social distancing and washing our hands are measures that we could easily do to protect ourselves and each other. At my clinic where I work, all of our patients, when they come into the building, can count on everyone being masked. And I would like to feel similarly protected when I go out into the community in Shorewood. And so it was disappointing to me when I went grocery shopping at Metro Market and found that many shoppers were not masked. And for that reason, unfortunately, even though I wanted to support them, I started shopping at Outpost where, as the previous speaker had mentioned, there is a masking requirement for both employees and shoppers. So I think by enacting a mask requirement, the village will be acting in a way that will be protective of the health of our residents and also helping the local businesses as well, so that we feel safe when we're out and about and supporting our local businesses. So I appreciate the opportunity to talk, and thank you.
Thank you, Hong. The next speaker I have is Jeannie Salmon. Jeannie, if you're on the phone, if you could unmute yourself and say your name and address, please.
Hello, my name is Jean Salmon, and I'm also at 1905 East Sharp Street. And I am here because I am 100% in favor of a mask requirement in the village of Shorewood. I am, it sounds like, among many others who feel the same way, and that I do not feel safe going into my community. I have not visited the parks this summer because there are just so many people who are unmasked, and I can't control what they do while I'm there with my mask. I feel like going into Metro Market is just taking your own life in your hands because once again, it is nearly impossible to social distance in some places in the store, and especially when people are not wearing masks, it makes it very difficult. And so this is a very exciting time for Shorewood. We have the opportunity to be leaders in our communities, to be the role models that say, yes, we are going to protect our citizens. We care about the health. We want everyone to live to see another year. And so I am so hopeful that this will pass unanimously, that we will set the example and our neighbors will follow suit, and that we can help protect the wellness of our community and that everyone can feel safe. Thank you.
Thank you. Next we have Salva Strogalov. Salva, if you could unmute yourself and say your name and address.
Good afternoon or good evening. My name is Slava Strogalov. Look, I reside at 2324 East Edgewood Avenue in Shorewood. I support the personal distance idea. Guess I'll be the only one that is slightly concerned about mandating face masks, and just please bear with me on why. So mandating face masks for everyone, I do not see a solid scientific support in this. The example is a statement from the Lancet journal that states that masks in multiple ways are highly protective in healthcare and community setting. And it was also stated by Dr. Holger Schumann, which is an epidemiologist and physician at McMaster University in Ontario. Now, the follow-up to that statement is that they have low certainty in that, which was published in the same publication. Now, this means that the authors cannot be strongly confident in the benefits. The standard scientific studies were, I see that they were never performed, such as randomized, double-blinded controlled trials. Dr. Schumann also cautioned that the studies collected in the Lancet were observational. They were not randomized trials. World Health Organization still states that cloth masks have very low incidence of protection from COVID-19. Hand washing is the best way to prevent viral transmission. Even the CDC still states that even though they recommend wearing a cloth mask, Cloth mask will not prevent you from breathing in or out respiratory droplets which carry a virus like COVID-19. I mean, similar results were presented by Harvard Medical School and Stanford University, showing that cloth masks are ineffective in preventing viral infections, which includes factory-made N95s. The new designs that Stanford is doing is having oxygen pumped into the mask to make them more breathable with a tight seal. In my opinion, this level of insanity is profoundly disturbing. In addition, when we consider the pore size on any breathable mask, it is at least 1,000 times greater than any virus particles we're trying to filter. I mean, this kind of renders them useless for viral protection. Please remember that COVID-19 is 0.125 microns in size. I mean, even Drs. McIntosh have presented the fact that cloth masks will still allow viral particles to exit and breathe in. Now, these studies also do not settle on the question whether the protective benefit of face mask derives from the barrier it creates or from behavior changes it may prompt. Now, currently, the suggestion to mandate face masks on community is based on fear, emotion, as well as improperly understood and reported scientific studies. I served in the U.S. Army as a combat medic, MOS 91 Whiskey, for 8 years. I'm very well trained in the chemical and biological warfare. Any mask that you're mandating people to wear does not provide any protection from me, from them, or to them against me. The unfiltered air still gets in and out from the front, sides, or any other opening on the mask, to include the fabric spores. If you can breathe through the mask, it does not protect you nor prevent viral spread. We still transmit viral particles whether we like it or not. People still breathe the same air outside, in their cars, in their homes. Not one store, home, or organization uses positive pressure HEPA-filtered air in their establishments. This is the only way to ensure that the air breathed in is truly sterile. We are ignoring the fact that we live in a single atmospheric bubble and share everything that comes in or comes out. Breathing out causes microdroplets to remain in the air for hours and travel for miles. They end up on your clothes, hair, skin, gloves, mask, absolutely everything. Only one viral particle is necessary to infect. This must be remembered before making any mandates for mask wearing. Also, wearing of the cloth mask restricts breathing, which can be problematic for some people. People not always aware of signs of low oxygen. If you're going to encourage the use, a disclaimer must be made on every mask that masks restrict breathing and can result in less oxygen. Also, listing signs and symptoms to look for that may indicate low oxygen levels is imperative. My U.S. Army field medic training always stated, keep the airway open. This is going the opposite, restriction oxygen to the brain and other vital organs. This is especially important in children whose brains are still developing. Do remember that the female brain development is until the age of 24 and males are until the age of 26. Wearing of masks, I believe, is unhealthy. You are rebreathing your moist air and germs. The moist, dirty air gets in the pores of the skin, thus starting to rot it and create breakouts and inflammation. Additionally, the restriction of oxygen breathed in can cause carbon dioxide narcosis, as well as brain asphyxiation, especially in children. Thus, by suggestion wearing a face mask, you are harming their health, something that I believe government policy and schools have no intention of doing. Young people are the future of our society, and the masks are hurting them, specifically children who you are forcing to put the mask on. Children build their immunity by being exposed to the environment. Our innate and acquired immunity is the best defense that we have against viral challenges. If people are locked in a bubble and at some point come out, they will get seriously sick with a potentially fatal outcome. Every time I see a person remove the mask, wipe their face, and put the mask back on, renders mask wearing practice useless. The masks are also causing unintended psychological damage. We as humans are social and emotional creatures that take many cues from facial expressions and emotions. Forcing the human to cover their face is inhumane and insulting. Preventing our children from learning the body language and facial expression will rob them of social defenses and understanding of our society in the future. Additionally, teachers will not be able to understand when something is wrong with the child, when the face is not fully seen. Same is for children. If children will only see a teacher in a mask, that is exceedingly difficult to connect with someone who does not have any human facial expressions. All you see is a mask and muffled sounds. Now, when we take all of our viruses, our viriome, and our bacteria, our microbiome that live in our bodies, and put them in a pile, they will weigh about 4 pounds. My heart, my kidney, my lung, my liver, all weigh approximately 4 pounds each. Now, this tells me that viruses and bacteria present on my body are just as important as one of my organs. Wearing a mask may rob me and all the people wearing masks of their acquired immunity. Additionally, it creates so much biohazard waste that litters parks, beaches, playgrounds. I mean, it's our wonderful environment. I mean, and lastly, it's like, how do you enforce it? I mean, we're humans. We can't be policing each other and whether we're wearing a mask, touching the face, or standing closer than loud. I mean, this will create so much more despair and distrust, as well as more adverse health consequences than benefits. I mean, if you're going to make any recommendations, just recommend people who are ill to stay at home and get tested before coming back to society. I think having a survey by a health department to those people is great. And lastly, I mean, if it's absolutely must, just recommend face shields. They will actually prevent any droplets or coughs from coming directly outside. Thank you. I'm grateful for your time and attention.
Trustee Stokebrand, can I make a suggestion?
Sure.
I don't know how many people there are who would like to speak, but I think if we could get to the board to actually get our discussion by like 9, that might be a good timeline. And I'm just wondering if we could ask people to limit their comments to 2 minutes so that everybody has an opportunity. I don't know how the rest of the board feels about that.
It's my understanding that we haven't limited board citizen input time before, but I'd be willing to go around the table. Trustee Bockhorst? Do you favor a time limit of 2 minutes?
I'm fine with the time limit of 2 minutes, especially since if we get through everyone, they may or may not have another opportunity to speak. Sure.
Trustee Carpenter?
I think 2 minutes is reasonable.
Trustee Ursink?
I'll defer to the majority.
I'm in favor of the 2 minute. Trustee Warren?
I'm also in favor of the 2 minutes, given the urgency of the matter we're discussing and the fact that we'd really like to get into it tonight.
Okay, so perhaps I guess we're going to look for sort of a warning from Sarah then. I do want to make sure I see Steph from the bid. Can I ask that she have an opportunity to speak next because she represents a business district?
Yep, so we're done with any emails that were previously sent to me prior to the meeting. So there's about 7 hands raised right now. Steph, you are first if you would like to unmute and say your full name. Thank you.
Good evening. Can y'all hear me? Okay. Hi. Yep. I'm Steph Salvia. I'm the executive director of the Business Improvement District. I have been talking with our businesses a lot about masks. It actually stemmed from a conversation I had with a resident who is immunocompromised, and she had asked if there was a resource because she wants to keep supporting the Shorewood businesses, and she can only go to those businesses that do require masks. And truth be told, I have not heard any of our businesses expressed anything negative about mask wearing. In fact, I think that the majority of them would support, everybody kind of sticking together and doing the same thing. It's hard for residents also to kind of piece together, which stores they can visit or which stores they want to support because those stores do require masks. So we have definitely heard that our businesses do support something like this. That's all. Thank you.
Okay, and then the other one I wanted to get in right away was a school district perspective. Is Jody Brooks available? Mr. Brook, it was my understanding that he would have a school district point of view. Jody Brooks.
Jody, if you could unmute yourself and say your name. I believe I see you on the call.
He is, he's unmuted.
Yeah. We do not hear you.
Perhaps, Jody, an option would be for you to, oh, there he is. He's getting his headset on. Perhaps, Jody, you could call in, you could keep your video up, but you could call in on a cell phone with the call-in number. Oh, perfect.
Perhaps we could move on and while we're waiting for Jody to call in.
Sure. Let's take the next person. I have Scott Baxter. Scott, if you could say your name and address, please.
Hello. I just want to double check you can hear me okay.
Yes.
Yep. Okay. I'm Scott Baxter. I'm at 4464 North Bartlett. I guess initially just want to reiterate the points that Slava had brought up. I think I appreciate a whole lot of. There's just a lot of information, a lot of really interesting things that are going on, and we're learning more and more every day. There's a lot of key points there that I feel are very important to understand. So I appreciate a lot of what I heard there. I do feel like the masks are beneficial for like indoor use, that kind of thing. At the same time, I guess I have questions like, do we have any kind of a material mandate of any kind? I mean, do we have a deciding what is allowed or not allowed? I went to Metro Market a couple nights ago and I saw like even employees that are wearing masks, they're not wearing them correctly, not covering their nose, or it's got open pockets kind of thing. I feel like if we wanted to, or felt that we felt to mandate a mask, I feel like a face shield would also make sense here. I know that it makes it much more complicated, but if that's the level we're at, that feels much more like it's actually going to make an impact. So I guess I'm trying to understand, I guess, the pieces of whether or not we have indoor outdoor type stuff, what the materials are going to need to look like. I feel like indoor, I will absolutely wear a mask for peace of mind, to just both visually appealing to people that are around me, at the same time know that I'm not giving anything that I might potentially have that I don't know I have. So I think it's important to understand. I don't personally feel like outdoor is going to be any benefit at all. Yeah, I don't really know what a mandate would look like. I'm kind of curious if we've got any conversations about like a fine or how it would be reinforced. What are people going to say? What businesses are going to be able to say to customers, that kind of thing. Yeah, kind of just more of the general, what we've got going on currently. Other questions here. I guess I question if we have like a cotton mask and we're outdoor, we've got 80+ degree days outside, restricting airflow is pretty complicated thing. I feel like it's just going to rise, it's going to bring more health concerns. So yeah, I think that's about it with my list of questions. But yeah, I feel like indoor is kind of more or less just kind of visually peace of mind for other people that you've got, knowing that so many people, even if they have them, they're just kind of not wearing them appropriately.
Thank you,
Or
Scott.
the material may not be helpful. Yep,
Thank you.
Thanks.
Thank you, Scott.
All right. Next, if Jody is on the call. Jody Brooks. Okay, we will move on to Jeff Davidian then. Mr. Davidian, if you could unmute yourself and state your name and address.
Hello? Can you hear me?
Yes.
Okay, this is Jeff Davidian, 4101 North Prospect. I wish that everybody would wear a mask, and I congratulate you for having this hearing. As the previous speaker said, when I go to Metro Market, I see the employees wearing a mask with it pulled under their chin. And you wear a mask so that when you're close to each other, you show respect to the other person. But when they are wearing a mask and speaking to each other, they pull the mask down rather than to put it up. So what we are faced with here is people simply don't want to do it. Some people don't want to do it. They don't want to wear a mask. We see on television people becoming violent and attacking people who tell them to wear a mask. So in my opinion, if you don't enforce it with a penalty and do it now, the people that aren't wearing them now will continue not to wear them. If you mean what you say and you want to have an impact, then put a penalty to not wearing it. Otherwise, it would be like the states that nicely ask but don't want to pass a law, and those states have a resurgence of infections, and the ones that try harder don't. And let's be one of the ones that don't. Thank you.
Thank you, Jeff. I don't see Jody Brooks back on, so we will go to Stephen Murphy. Stephen, if you could unmute yourself and give us your name and address.
Hello. Murphy at 4163. I appreciate that board. I'm in favor of you passing the ordinance. There's a lot of arguments, reasons why to do it. I'm a family physician. I work with Advocate Aurora. I'm one of the faculty members in the Department of Family Medicine. And I'm taking care of patients at St. Luke's on what we call the COVID wards. There's no doubt we're in a crisis. Like a lot of natural disasters, it doesn't affect everybody equally, but it is there, and we need to take action to decrease the harms. I want to encourage the trustees just to think about evidence that's what's called epidemiological. There's a lot of science out there, a lot of scientific facts, things that are true, but then we say, well, how does that apply to reality? And epidemiological evidence comes from like what's called experiments of nature. Like in reality, what happened to a group of people? Because we're not going to get a controlled study where we let some people go around without masks and some people with masks and expose them all to COVID. And there's an article in Health Affairs, which is a prestigious, well-respected journal, and it was published in mid-June, and it looked at 15 states and DC, and it looked at what happened when there was a mask mandate, both before and then after that mask mandate. And each state did the mask mandate differently, some with fines, some without, but all of those states that had the mask mandate, and in DC where they had the mask mandate, there was a decrease, a slowdown in the daily COVID-19 growth rate. And that's what we need. We need to slow down, flatten the curve, they were saying, and we need to do that again, because Wisconsin is seeing some of the highest growth rate in the country right now. That's the reality we're looking at, and the mask mandate can slow the growth of the spread, the growth of the growth rate of the virus by almost a full percentage point in the first 5 days, and then after about 3 weeks, it can slow it down by a full 2 percentage points. That makes a difference. That saves lives. I hope you pass the ordinance, and I think that it does require a lot of education to do it right. Positive reinforcement. I'm in favor of rewards and reinforcements rather than punishments.
Thank you, Susan. Have a great night. Next we have Nan Wu. Nan, if you could unmute yourself and give us your name and address.
Hi, this is Nan. Can you guys hear me?
Yes.
I'm at 4314 North Ardmore. And I just wanted to echo the previous community member's point. I'm actually a surgeon in town, also with Advocate Aurora. And I specifically want to make the point that I wear a mask for 8 to 12 hours a day in the operating room, and my oxygen levels are just fine. So if that is a reason to not wear one, then perhaps there is a lot of misunderstanding and education that's needed to correct those thoughts. I fully support this ordinance, especially indoors in businesses and public places such as public markets. And I do thank you for bringing it up in discussion. Thank you for your time.
I'm sorry. Sorry to interrupt again. This is Trustee Backhorst. Just
Yep.
wanted to let you know that I know that you were waiting for Jody Brooks, and I see that he's unmuted now. So I don't know if he's still in the queue. Although I can't hear you, Jody.
Hi, Jody. Are you, if you could say your name and address?
Oh.
I don't think it's working.
He's always actually been shown as unmuted. Okay. I just think that he's having an issue with his connection for some reason.
Okay.
So why don't we go to the next caller and then we'll see if he can chime in.
All right. Next we have in the queue is Kristen Seitzero. Kristen, if you could say your name and address.
Yes, hi. My name is Kristen Ciarto. I'm at 4018 North Morris Boulevard here in Shorewood. I want to thank all of the medical professionals who've spoken, the McIntoshes, Hong Vu, Stephen Murphy, and Nan Wu, who've brought us some actual medical evidence and experience about what masks actually do. I'm concerned that a few of the speakers are not clear on who the mask is protecting. The mask is not protecting the wearer. It's blocking the wearer's germs from getting to other people. The only other thing I'd like to add is I'm aware that the village has considered adding a racial equity check on many policy points. And I want to raise the issue of the racial equity dimension of an ordinance like this. This ordinance is a step in the direction of racial equity. Many of the service workers, essential workers that are not able to work from home remotely, as I personally have the privilege of doing, which is nice. But many of the essential workers out there are Black and brown people who are not only having large, the case numbers are going up and the death rates are 2 to 3 times higher than the death rates for white people. This kind of ordinance will protect the people who are having to do their jobs in public places, regardless of their skin color. It just so happens that thanks to systemic racism, many of those people are Black and brown people. And so for us to stand on the side of racial equity, we need to pass this ordinance. Thank you.
Thank you, Kristen. Next we have in the queue Amanda Brando. Amanda, if you could unmute yourself and give your name and address, please.
Hi, good evening. My name is Amanda Brando, and I'm at 4606 North Woodburn in Shorewood. Thank you very much for convening this meeting and for discussing this very important issue. I am a pediatrician and by specialty also a pediatric hematologist, and I practice at Children's Hospital. I'm in the faculty at Medical College of Wisconsin, and I am in very strong support of an ordinance for mask wearing both indoors and outdoors in public settings to protect the public health of everybody in our community, as has already been eloquently outlined by data supporting this by many of the medical professionals on this call. So I will not reiterate that, but I in support and I've reviewed those studies and concur with those outcomes. I would like to speak to the topic of children wearing masks. As I said, I work at Children's Hospital, and everyone who enters the hospital over the age of 2 is required to wear a mask during the entire time that they're seeking care there, certainly in the outpatient setting. And so I think children can wear masks safely over the age of 2 years old. This is also confirmed by the CDC recommendation that children 2 years and older should wear a cloth face covering when in public settings. And so there's, I think, no significant medical indication where children, masks are contraindicated in children. In fact, you know, I take care of very critically ill children and children that have a lot of chronic health conditions that put them at high risk for COVID-19 illness, among other things. And masking is incredibly important to protect them. So we have a right and we have a duty to protect the health and welfare of the other children. In addition to the fact that children are asymptomatic spreaders, oftentimes are asymptomatic carriers of the virus, so may not even know they're infected and have the risk of spreading it. And so I strongly support lowering the age for mask wearing in children. The requirement, I think, you know, I appreciate the point of people going, children K4 requiring masks in school. So I think, you know, it would be very reasonable to require children ages 4 and up to wear a mask, and recommend children ages between the ages of 2 and 4 to wear a mask. So that would be my recommendation from the point of a pediatrician and a subspecialist who cares for immunocompromised children. So thank you for the opportunity to speak and consider this ordinance.
Thank you, Amanda.
Hello, this is Jody Brooks. Can you hear me?
Hi, Jody. Yes, we can. Thank you.
4 sets of earbuds and a phone later. Okay. I apologize for that. I have no idea why my computer won't allow me to use its microphone.
That is all right. If you want to go ahead
All right.
and give your name and address, that'd be great.
Sure. My name is Jody Brooks. My address is actually 2441 West Good Hope Road, which is Glendale. So I'm not a Shorewood resident, but I am a recreation director for the Shorewood School District. And I guess our input, for the most part, we definitely, you know, are pro mask. We strongly recommend mask at all of our activities. What our concern is in the discussions we've had for our programming over the next few weeks is, as someone mentioned earlier, the temperatures and the outdoor programming. And, you know, we want to just make sure it's considered. And we are definitely doing some research and hope to have more discussions with the North Shore Health Department in regards to, you know, are we okay holding programs outside in roughly 90-degree weather with children with masks on? You know, that it's just a concern that we've discussed, and we need to game plan how we would go about that. Right now, we do our best to socially distance. And when I say that with children, you know, you definitely need to try to do your best, because social distancing isn't in their nature necessarily. So, but it is something we've been doing our best to try to make happen. But and then as we move into later in July, August, and potentially high school sports begin, you know, this very well may be an issue with some of the outdoor sports too, and the effects that wearing a mask, you know, while practicing outdoors. The indoor part, I don't think we have any issues with that whatsoever. It's just we definitely want to make sure there's consideration for possible negative effects with mask on in the heat over the next handful of weeks.
Thank you, Jody. Hold on. I believe Trustee Carpenter has her hand raised.
Is there, in regards to children in the heat with masks, is there that pediatrician who was just on? I just would be curious. I don't know if for procedural reasons, if we're able to do that, but are we able to ask a question of that pediatrician? I just want to understand the thoughts of concerns in heat with children in masks.
Yeah, it was Amanda. Is Amanda still available? Amanda Brandow?
Thank you.
Is she still on the call?
I do see her on the call. Amanda, if you would like to unmute and speak to that question, that would be great.
And then I think we have 2 more after this question is answered, and then we'll go back to the board, please.
Correct.
And then I guess I would add one more thing, and that is we do have the fitness center and people exercising, and we worry about, even though that's indoors, people wearing a mask when exercising. And just so people know, we've been open, the fitness center's been open for about a week now, and we probably are seeing about 25% of what we would normally see as far as participation. So it's a relatively, you know, low volume right now. So at any one time, you're no more than likely to see, you know, 4 or 5 people in the whole fitness center exercising. So it just so far so good, as far as there's been no issue whatsoever of even, you know, excessive social distancing. Most people are plenty far away from each other.
Great, Jody. Thank you. Amanda Brando, are you still on?
Otherwise, I wonder if Jennifer, I see Jennifer is still there. Didn't she have the pediatric background? Perhaps she could answer the question that Trustee Carpenter had. Jennifer, are you there?
Jennifer McIntosh, right?
Correct.
I'm here. Amanda had to go and take care of a child. She's on the call, but still muted. I'm actually an obstetrician, not a pediatrician, but I can tell you, I can answer this question. This has been sort of a debate in some other policy groups that I'm involved in. The heat does not cause ill effects of children. Yes, they may feel hotter, but there's no ill medical effects from the mask. Same thing with exercises. In fact, a medical school classmate of mine did an entire hour-long Peloton workout in all the different types of masks with an oxygen meter on her finger to show that her oxygen status remained exactly the same throughout the entire workout, regardless of wearing a mask or not. So I mean, again, that's just a personal example, but there are very few medical conditions or age restrictions related to mask wearing that can't be met, and certainly the village could come up with, a small list of exceptions that those residents could explain to others.
Thank you. Did that answer your question, Trustee Carpenter?
Yes, thank you very much.
Thank you, Jennifer. Next, we have up Nick Plummer. Nick, if you could unmute yourself and say your name and address, please.
Hi, good evening. My name is Nick Plummer, and my business is at 4114 North Oakland Avenue in Shorewood. I would just want to thank you all for giving me the time to speak, as well as for all the healthcare workers that have given their professional opinions and research during this. It's not a win-win situation by any means, especially for Ann Christensen. You've been a lifesaving for my business. Your people have been incredible in working through all these unique problems with my teachers. But I do have a few questions, for the board, and for some of the physicians, namely the research that I'm seeing. I can't find anything that breaks out ages of children being infected. So, from 0 to 9, Drs. McIntosh, it showed 0%. For 10 to 19, it showed 0%. How do masks, and my questions would be, how do masks affect the speech development of young children, as well as what one of the community members, I don't know his name, said in regards to picking up body language, social cues, facial expressions. How are we stunting their development at that age if teachers are constantly muffled and they can't see smiles, if they can't feel, what those teachers are expressing through body language? For the pediatricians that are on here and the other physicians, and maybe Ms. Christensen as well, how many cases of COVID have been community spread to children in Wisconsin? How many of those cases have been hospitalized? How many of those hospitalizations have had negative outcomes? Children going into Children's Wisconsin Hospital being required to wear a mask for a limited amount of time, they're going to the hospital for a reason. These are sick children. They aren't healthy children that are out in public. And so those are kind of things that I look at. When I hear doctors talk about something isn't contraindicated, well, that doesn't mean you do something just because it's not indicated that you shouldn't do it. For the pediatrician at Wisconsin Children's, how many children has she actually had to deal with COVID? Because what I'm seeing in the media is there isn't a lot that have been COVID positive. And granted, no family wants to be the one of a statistic. It's very important to that family. But, at what point is enough enough? We look at masks. Eventually we have to go to iPro, to gloves, to suits with oxygen, face shields. What's the cost benefit? I'm sorry, Trustee Amenta. The last thing I'll ask is, what is the consequence for children in my center if they take their mask off? I can't punish a child that refuses to put a mask on. Do I kick them out? Do I tell their parent they can't come? 70% of my student body is healthcare workers' children's. So do I tell that doctor or that respiratory therapist, hey, sorry, you can't go to work today because your child doesn't want to wear a mask in school? Thank you for your time. I appreciate it, and I look forward to the answers.
Thank you, Nick. Next we have Patricia Hugh. Patricia, if you could unmute yourself and then state your name and address, please.
Hi, my name is Patricia Howe, 2029 East Marion Street. And I will try to keep to 2 minutes, although I noticed the early speakers were able, from the community, were able to speak quite a bit longer, including long presentations. So one question I have is, have we seen, because I watch the numbers pretty regularly, I'm a critical care nurse locally, and I know that our death rate in Wisconsin has gone down and continues to go down. I'm wondering, was there a spike in cases in Shorewood, or is that more the local community? I really appreciated a lot of the scientific evidence from all the participants, but I thought especially Slava Strogalov had some very interesting feedback or insight into what masks really help protect from. And I know the first presentation we saw from one of the community members and the distance that droplets can travel, I thought was great. Although I noticed that from, and I can't remember if it was a meter, the level of evidence was moderate, and in the bottom section, the level of evidence was low. And in the medical community, you usually look for strong level of evidence. So I know that it's, are we really protecting what we think are we protecting? I absolutely support a recommendation to wear masks in public places. I absolutely do not support a requirement of masks to be worn indoors. I think it could have a negative impact on businesses, and I do not support having a mask requirement for outdoors. And having to wear a mask all day long at work, and somebody with asthma, yes, I can do it, but I end up pretty dehydrated every day because your fluid intake is not the same. And if you're requiring masks inside and outside, I think people are going to, especially in the heat and summer, have problems with dehydration. And yes, maybe someone who's out healthy and working in the community, their oxygen levels don't dip when they are working all day with a mask. However, not everyone is healthy, not everyone is young. And I do think people with medical problems could have some issues. And although I appreciate the feedback from the businesses that are allowed and have the capacity to have outdoor seating, I worry about those that do not and where there is no choice. My recommendation would be that this is strongly recommended to wear a mask on any inside, and support businesses that they have the capacity or are able to allow a requirement within their business. And then you can choose, community residents can choose to abide by that or shop somewhere else. And I think, and Ms. Amenta mentioned something earlier about getting along with each other and some discord it might set up in the community. Say you have someone, because I see people at baseline who can barely breathe without mask. And then if you have some medical problem where wearing a mask is difficult, and I could see that setting up some discord between community members. And I think we should strongly consider, again,
Thank you, Patricia. I will have to cut you off. Thank you.
Yes, but sorry that the other speaker got much more time. Just so that's noted.
I understand. Yeah. Thank you. Next, I'm going to take Justin Elmquist. I will come back to you, Jennifer McIntosh. I know you've just spoke, so I want to make sure we get everybody who hasn't spoke yet. So Justin, if you could unmute yourself and provide your name and address, please.
Hi, my name is Justin Elmquist, and I live at 4333 North Oakland Avenue, apartment 215. I'm not a medical professional, but I do want to thank all the medical professionals that were on here tonight and that have provided their wisdom and the science behind why wearing masks, both indoors and outdoors, is beneficial. I'm someone who, I like to run outside, I like to exercise outside. I have been wearing a mask while I run, and I just want to say it has not impeded my ability to run at all on a personal note. I think that this is something that's important for all of us to do for the betterment of our community and to show that we do all care about each other. In response to, I know that Nick Plummer brought up, what do you do with kids who may take off their masks? What I would say as someone who has worked with children in the past in different jobs, you just ask them to put it back on kindly. Most kids, in my understanding and my experience, will end up putting a mask back on or will end up doing what you ask them to do. So I just once again want to thank you all for having this conversation tonight and to voice my support for the mask mandate indoors and outdoors. Thank you.
Thank you, Justin. The last public comment it looks like we will take is Jennifer McIntosh. Jennifer, if you could unmute yourself.
Hey, yeah, this is Brady. I just wanted to respond to a couple of the questions that were leveled at us a little bit earlier. To Ms. Ha, as Dr. Weinhardt mentioned earlier, you know, we're still in the very early stages of dealing with this this pandemic and this new disease, and the science evolves over time, and the recommendations evolve with the science. So we are giving our best recommendations based on the evidence and the science that we have now. It's imperfect and it may change over time, but from what we know now, mask usage and specifically mandates from governmental bodies to use masks in these public scenarios does decrease the rates of infectivity and decrease the incidence of contracting the disease and improve morbidity and mortality. And to Mr. Plummer, the data that we showed earlier that discussed infection rates amongst people based on different age had more to do with the deaths that are associated with those ages as opposed to the rates of infection. Children do contract this disease. They also serve as vectors for the disease and carry the disease without symptoms, just like normal healthy adults and sometimes immunocompromised patients and older adults. People can go through the life cycle of having this virus without showing any symptoms at all. And they do spread and transmit the disease without showing symptoms. And perhaps one of the scarier outcomes of this disease is what's called post-inflammatory vasculitis that does happen with children where they develop a viral syndrome with fevers and cough and muscle aches, and then 10 days to 2 weeks later develop systemic vasculitis that causes damage to their kidneys, their mucous membranes, their skin, and children have been hospitalized for that in our community as well as many other communities as well. So just wanted to respond to those, and again, I appreciate your time.
Thank you, Brady. That is it for public comment, Trustee Stokebrand. So if you would like to go back into board discussion.
Sure. Okay, so at this point, I think we should go around the table. I did want to ask, it seemed like there was a consensus to go forward with a mandate. Before we get in the discussion going around the table, I looked at Rebecca's email. What was the time frame if we decided to do something? You said staff could not implement this immediately. Would it depend on what we approved, or can you give us a time frame that we'd be thinking about? Obviously, today is July 8th. We meet again on August 3rd regularly. Can you give us a little feedback, Rebecca?
Sure, I think it's something that I'd need to consult additionally with department heads. But I think for us, it's a matter of hearing more from the board at this point in terms of how they're looking, what they're looking to apply within the scope of the ordinance. Because there was a significant number of clarification questions that were posed by department heads that I think is going to be important in terms of how we would put together any type of plan.
And did Chief Nimmer, it looked to me like the way the ordinance is, the draft is, it would mostly be punitive for the businesses. Is that correct? I guess that'd be for Nathan.
Right. Well, I guess that's a policy question. Would the citation or will the enforcement action be against the business where the individual was, or would it be issued to the individual who wasn't complying? And I guess really that comes into play when you look at outdoor requirements as well, because there you're not really attached to any particular business, or so if somebody's in a park or if somebody's on municipal property and they're not complying with the ordinance, So that's really a policy question that will have to be decided as well.
Okay, and Chief Nimmer, did you have anything you wanted to add at this point about enforcement before we go around the table and work on the discussion?
No, I did not. Thank you.
Okay. Trustee Amenta? And if anyone wants to make a motion as part of their going around the table.
I wonder if we can discuss indoor and outdoor separately. So maybe start with indoor.
Okay.
I mean, indoor, I'm okay with a public. Do we define what a public space is in this ordinance? So obviously, okay, we don't really define it, do we? Nathan, is it defined in here?
There's not a definition of public space.
Okay, I think we would need to define so we know exactly what we're talking about. But yeah, I think any place that's open to the public. I know one of the questions that was brought up about the customer service staff was, you know, essentially they're 6 feet apart, and it's not like there's public constantly in there like it's Metro Market. You know, the public comes in, and there may be in days where there's not many in the public there. So I do think that in that case, people who are working together in an office that have occasional public contact, I think it might be punitive to say that those people need to have a mask on, you know, all 8 hours of the day that they're working there. But maybe when a member of the public is there, then everyone should be masked. But yeah, I mean, for my kids, you know, I don't know that there's a lot of 4-year-olds. I don't know how many 4-year-olds there are. Maybe some people's 4-year-olds, I don't have a 4-year-old now, but maybe some people's 4-year-olds would be fine with that. I think 4 is pretty young. I think 5 is pretty young. And I think we also do need to take into account what the school district is talking about doing in the fall. I mean, if we pass this, then I think it would apply to the schools as well. So I do think we owe it to them to have some conversation with them about, you know, on the mask issue where we should draw that line. So I guess I would like to, in terms of tonight, I would have preferred to have been able to actually adopt something tonight. I mean, I would prefer not to have another special meeting. And I think this is something we need to do sooner rather than later. But I guess I feel like it does need a little bit more. It obviously needs a little more definition. I think we need to think about office, you know, what office situations where there's an occasional person coming in versus constant public contact. And I think we need to have a little more discussion with the school district. So I don't feel it's quite ready tonight. I wish it was, but I don't feel it's quite ready. So that's where I am.
Okay, thank you. Trustee Bockhorst.
I'd like to go a little bit later in this, just because I think I have a little bit more information that I could answer a lot of the questions that the trustees bring up.
You don't want to, if you have a lot of information, I think we should probably get it right now.
What I mean by that is if you could let others speak first and then come back to me, I'd appreciate it.
Okay, Trustee Carpenter.
So I think where I stand is I feel like it's imperative that we move forward with, with some sort of, with something coming out of this meeting to come back to another special meeting. I feel like every day matters right now. We're one of 4 states in the country that does not have a mask mandate. And our transmission rate is currently the highest in the country. So, you know, every little bit that we can do And the sooner we can do it, the better we can be. So I would like to make some modifications to the ordinance. I would like to change the outdoor distance from 30 feet to 6 feet. I'd like to change the age of the children from 2 to 4. I'd like, I'm open to defining what a public space is if that's necessary, but I think a space that is open to the public. So I know Rebecca was questioning Village Hall. Village Hall currently is not open to the public. So, if you are a business that is open to the public, you need to require masks. Whether that is a restaurant or Metro Market, any building and any space that is open to the public must require a mask. And I think while what we have right now is not perfect, it is better than what we currently have, which is nothing. So we cannot let good be the enemy of great tonight. We have to get something, and we have to get something done tonight. So I know that there is some concern regarding enforcement as well. And I understand Director Christensen's concerns, and they are very valid. But I think, as many people have mentioned, our businesses need something to fall back on so that they can require their customers be wearing a mask and be able to protect their employees as well. So I don't know if making a motion, I don't know if you want to go around one more time. I'm happy to make a motion.
Why don't we keep going around and then
we can,
yeah.
Okay, and then and then if we want to go around one more time, I'm happy to then sort of draft up in my mind a motion.
Okay, thank you. Trustee Ertink, please.
Thank you.
I think we're in a situation where this isn't going to be perfect right off the bat, as Trustee Warren said, and I think a lot of the board is echoing. I would like to get somewhere tonight, whether that be we focus on one aspect of this, which is the indoor aspect, and then visit the outdoor aspect. I think a lot of this is going to take, it's going to be stressful for our staff to implement right away everything. So I'd love to hear maybe a little bit from the staff, from Rebecca, on kind of what the timeline is, and if she'd feel comfortable moving forward with an indoor policy before an outdoor policy. That's not to say that I don't feel like we can do both at once. I just feel like, if we start somewhere, whether it be in the indoor section, then I think we can get a lot more accomplished. But I'm in favor of both indoor and outdoor. Enforcement also is going to be an issue. I think when it comes down to it, this is going to be a very symbolic vote. We don't have the staff, as Ann Christensen has said, they don't enforce. I would not recommend also Shorewood Police Department enforcing this, which could lead to many more issues. So we are going to create a mandate that really isn't enforceable. But I do think the symbolic gesture is powerful enough, and it'll give the community, the business community, an opportunity to point back to the village. And then we can answer, the residents that have a problem with it. If Ann does have a suggestion on enforceability, or Rebecca or anybody else in the village, I would love to hear their opinions on that. I'd love to leave tonight with voting on a motion for a mandate, at least in public spaces. So I'd like to continue listening to the rest of the board's opinions, but I would like to try to get something accomplished tonight.
Okay, thank you. I also would like to see something happen now for indoor spaces, but and I also think the age, move it from 2 to 4. I think the 6-foot distance, to me, that's only relevant outdoors. Is that everyone's understanding that the 6-foot distance? Or would that apply to indoors too? Maybe I'm confused. my problem is how do we pass this and then say it's not enforceable, because it is for our village staff right now. It's not, we don't have a plan to enforce it. And I can't put my head on the pillow at night and say, we approve this, we think it's a good idea, but I have no idea how you should enforce it. And if someone can help me with that, I will vote yes. Trustee Warren?
I feel like that puts a lot of pressure on me in this position.
Tammy's after you, so.
well,
I'm sorry, Trustee Bockhorst is after you, so.
Well, I would echo what a lot of my colleagues said. Ideally, we would get something done tonight. Time is of the essence here. This is something where we've seen, unfortunately, this spike in cases nationwide over the last couple of weeks. Much as I would like to have a perfect resolution to this tonight, I don't know that we're going to get there. And I think that what we put together now, that was going to get us to a better place than where we were 3 to 4 hours ago. I think that we can work through kind of the public spaces part of this. I think if it's open to the public, I think that's a pretty easy definition. I also agree, as I said before, I really like the recommendation from between 2 and 4 and the obligation 4+. I think that makes a lot of sense. Also 6 feet outdoors, I think makes sense too. And kind of as a general kind of global observation, I guess my thought is that we're all obviously in this together. And I'm sensitive to concerns that have been raised about children taking off masks and being in public spaces. And I really think, this isn't something where the board is wanting the health department to descend upon people every time a mask isn't worn for 30 seconds indoors because someone forgets. I'm a lot older than 4 years old, and I can guarantee you that at some point I will forget to put on a mask and I'll think to myself, oh my God, I better put this on, and I'm indoors. It's not about that. It's more about knowing that this is something that we support, knowing that if it's something that's a chronic problem or issue or that isn't being enforced or isn't signed at the door and people aren't asking, then there is an issue that the health department may or may need to come in on. Trustee Stokebrand, to your question, I mean, I would see this as a much more kind of complaint-based enforcement. And I would see the complaint-based enforcement really as something where if there's a chronic issue, if there's a person or a business who's kind of flagrantly violating this and just not doing it or not complying, then I would think we would have an issue. This is not meant for the, I forgot my mask and I've been inside for 30 seconds and oh, now I'm putting it on now. So I'm comfortable. Again, I think that that there may be tweaks to this. We're unfortunately, this is something that we're going through and we're feeling our way through. But I would really like to get something done tonight.
And Trustee Bockhorst?
Yes, thank you. So I agree as well. I'd love to see something get done tonight. I also agree that we don't want to let the perfect be the enemy of the good, or in this case, maybe good enough for the beginning. I think we could boil this down, this ordinance, and I know the lawyers will probably agree with me. If we have fewer words versus more verbose, it could be simplified. We can always change it at a later date. Regardless of whether or not we address both indoor and outdoor spaces, I would say that I would be more supportive of using just a blanket across the board if there's 6 feet or fewer than a mask requirement. I think that should be, I don't believe that all the time that you're indoors, if you are not within that amount of space, is necessary, although I can see arguments against it. So I also want to keep in mind the whole equity issue that was raised before. Are we going to provide masks or not? And again, we can address that at a later date. Regarding enforcement, even the city of Milwaukee, even though the current form that you all saw states the health department, their health departments basically consists of 8 people. They're also not an agency that goes around and fines people. They also don't work nights and evenings and weekends when a lot of the cases, and the indoor cases, especially in the establishments that a lot of us will be looking towards, would have more of an issue. So enforcement is definitely tricky. I would recommend that for the sake of tonight's discussion, that maybe we scratch the enforcement issue and come back to that part, or that we look to that for now it's a warning, because I think the purpose behind this is for public safety and for education and for us being stewards to the community and beyond. So I would be reluctant for us to get right into a sort of, you know, a punitive or even a fine-based system. It's something, again, we can have a meeting for later on. And I understand having an ordinance without a way of enforcement is tricky. So I'm not even sure if you would call it an ordinance at that point. But I also, one of the other things that comes to mind, not only is when would this, let's say we pass something tonight, would we begin, when would we begin? And if we passed it tonight without worrying about the enforcement piece, we could do that. I think we're gonna get really stuck and hung up on this. And also the other thing that especially, so this is a thing, I guess this is for the lawyers in the room, and I'm not saying we shouldn't do this. I'm in full support of a mask mandate, but one thing we have to consider is when do we tie the term date to? And I know that, you know, for example, when public safety is involved, if the village of Shorewood were to say, hey, it's okay now, this mask ordinance is done, like when would that, what would we tie that to? Because, just a minute, Trustee Carpenter, let me just get through my other things. Again, which spaces would this be required? I think we could, again, boil it down to a more simple thing, and we can always modify this later. You know, places of public accommodation, or because again, if you have 1 or 2 people in an office that are separated by more than 6 feet, are they required to wear a mask? Oh, I'm sorry, going back to the enforcement issue, not only is it, or I'm sorry, that's not where I want to go. And I also think that, you know, we have to be a little bit more broad than saying a mask, because what if people do have a shield or some type of cloth covering? Again, we're trying to slow the rate of spread and keep people safe. And then I have one more thing. I had 2, I can't remember what the, oh yeah, sorry, back to enforcement and penalty. I think that this question was raised earlier, which is a really good one, in which we've heard Milwaukee a lot, is who do you penalize? Is it the person that's not wearing the mask? Because you cannot, it would be completely unfair to penalize a business or individual if someone were to walk into their backyard without the mask, and there's if they're violating the 6-foot distance, as well as in a business if they're not allowing people in based on the mask, someone comes in, you know, there are a variety of different things. And then, but lastly, I just want to talk about some language that I have an issue with here, which is regarding who can be within close proximity of other people. And the definition in here, it said something along the lines of people who are in the same household or family. You know, again, that's arbitrary, and to talk to, what I mean by that is we all have intentional families. We have different ways of expressing who we are and our, so if you're a single person living alone and you have your quarantine buddy who's also a single person living alone, or whatever the case may be, I think we need to scratch that language there, because it's also not incumbent upon us to be the police of, you know, when we see people out together and their own personal or kind of situations like that. I don't think that we want to be that provincial as to say that, you know, it must be someone in your family or within your same household that can be within the 6 feet of each other. And I know that opens up a lot, but I think that we get rid of that language. I don't feel that that's an inclusive kind of situation nor representative of a lot of our situations here. So I think that's all I have. I do think, except going back to, I think we could simplify this, get rid of the enforcement issue, have that come at a later date. Define, you know, we need to define again, you know, where this would, and if it's indoors and outdoors and we say within 6 feet, then I'm fine with that. Places of public accommodation, I don't know the legalese behind, you know, I know like even though University of Wisconsin-Milwaukee is not within our legal jurisdiction, it's a state-run agency. So it's, if it were, we would not be able to enforce it there. I don't know which other businesses or organizations would fall into that, and maybe that's not an issue. But I am glad that we are doing this. This is a progressive community. This is something that a lot of people have been asking for, and we do get to show our leadership. So it will be great for us, you know, to look forward doing something that helps the greater good. Thank you.
Okay, thank you. I see we have got several hands up and it's already 9:15. So I'm going to ask for Nathan. You have your hand up, please.
Thank you. I just wanted to make a couple comments just for practical consideration. At the end of the day, my opinion is that this regulation needs to be done by ordinance. So at the end of the meeting, I need not a motion, but something in writing that we can physically plug into the code that has all of the proper numbering and the language that's consistent with the remainder of the chapter that we plug it into and all of that. So here's my suggestion. It seems that there's 4 policy areas that the board needs to address. One is indoor regulations, another one is outdoor regulations, another one is age, and the last one is enforcement. If the body can come to agreement or consensus on those, what could be done is a motion to direct staff to draft an ordinance that can be adopted and placed into the code consistent with those parameters. And we could go back and physically create that. And you could call another special meeting that would last no more than possibly 2 minutes, where you receive back the physical copy of the hashed out ordinance that now fits into the proper area in the code and has all of the language that everybody asked to be incorporated in, and someone makes a motion to pass it, and it's passed, and then everybody goes home. So tonight would be the work on the policy side of it, and then we could create the actual physical ordinance that everybody would have in front of them, and then they would just vote on it potentially at another meeting, because I don't think we're going to be able to. I mean, I can try and pull it up, but I don't think we're going to be able to draft the ordinance on the fly and then take a break and then try and email it around and then vote on it. So just as a practical matter, it might, if you can reach consensus on those policy issues, you could make a motion to direct staff to create a final ordinance that fits into the code pursuant to those parameters, and we could do that rather quickly. So that was just my thought from a logistical standpoint.
Okay, thank you. Then I wonder if we should go around and how do we feel about a mask ordinance that applies to indoor uses? Davida, Trustee Amenta?
Well, like I said, I need to know a definition. I think we need to define what we mean by public indoor and what we mean by public outdoor spaces. So I can't really, I mean, I've already said I support it, but I support people having to wear a mask, but I don't support if it's an office where only 2 people come in during the day and there's 1 person in a reception area. It's open to the public, but I don't think that person should have to wear a mask the entire day because there's only 2 people coming in. So I don't know how we. So
then it would maybe like the 6-foot distance would apply. You have to wear a mask inside unless there is 6 feet of distance.
Or we define, the people working there versus the public who come in. And so maybe everyone who's from the public has to come in. And if you're working there, you have to wear the mask when interacting with the public. I mean, I just do think we have to think through some of these situations. I want to bring up a couple other things, like we set a policy on indoors, outdoors, but then we say, for the city should be village facilities employees, the village manager is going to establish a requirement policy for village employees and other persons. Why are we not asking the village to abide by the same policy that we're setting for everybody else. And if we're gonna have the village manager come up with a separate policy, again, you know, the issue that many people are concerned about and thinking about is school, when school hopefully starts in September. So if we're setting, you know, if we're setting legislation, which an ordinance really is, which is why we generally don't adopt ordinances the first time they're thrown at us and then say we'll go back and change them later. But because this is actual law, then I think we need to also think about that school issue and because this is going to apply also to school buildings. Then also on the penalty issue, I do not support going ahead without any penalty. I mean, if we're gonna, I don't support just doing something symbolically. If we're gonna do it symbolically, then we would adopt a resolution. The whole point of doing an ordinance is that it's not symbolic, it's actual law. And you know, it has to have some weight to it. It has to have some teeth to it. So, I mean, I think Wes was saying, you know, if we get a number of complaints about a business that is just not enforcing this at all, I think we either use our inspectors or we ask the North Shore Health Department or possibly the police department to approach the business and give them the warning and, you know, go through we have to have some kind of process for to have some weight behind this, or I just feel like that's important to do. So I don't know, did I answer the question? What was the question?
What was your feeling on the age and the outdoor mask requirement?
I mean, 2 I think is certainly too young. You know,
we're okay.
I don't have strong feelings about it, but I'm thinking 5 or possibly 10. I don't know, 5. I don't have strong feelings about that one.
An outdoor mask requirement at all?
Okay, so again, I don't know what outdoor public spaces is the sidewalk, is the street, is anywhere outside? I mean, I don't know what that means, but
all right. I mean, if you don't mind, then I'm going to move on. Did you have a little more? No. Okay, Trustee Bockhorst, please. Indoor, outdoor, age, and enforcement.
Okay, I think that the 6-foot requirement could apply universally to the indoor, outdoor. I will reiterate and also support what Trustee Amenta said regarding if someone's in an office building. I mean, there's so much nuance. I think it's if you are close to someone, I don't think that someone needs to wear a mask all day. I think that's a little too onerous and really kind of outside of the government's responsibility here. We're trying to protect, you know, people, the public, and also employees, right? So I also, but to that vein, we would want to encourage people when they're coming in and out of a place, when you're, you know, in places with limited visibility, because sometimes when you go around a corner, there's someone right there. So as far as the age is concerned, I definitely, I want to be clear about something regarding the schools. The point of this tonight isn't necessarily, at least in my opinion, to get kids back into the school. So I want to say that, you know, that would be great if they could get back to school in September for a variety of reasons. But the overlying raison d'etre behind this is public safety in general. So I don't feel like my arbitrary, you know, picking a number out of the hat of what I feel I can say as a parent, what I've gone by and what I think is appropriate regarding the age. So that one I'm just going to leave blank for now. I do think 2 is pretty young. I also want to remind people that we want to encourage not only public health as far as this virus is concerned, but we want to ensure that mental health and other physical health is still maintained. So if we get really restrictive on when you must, I know some people can run with masks, I know others, you know, have a hard time. We want to make sure that we still remember the rest of the variables that are important as far as living a solid life. And mental health, And, you know, we don't want to discourage physical activity or other things. So I think we need to keep that in mind as far as the age is concerned. I would even go higher. I would say 5, you know, again, that's arbitrary. And then back to the enforcement piece. For the smoking ban at the beach, I believe we had said something along the lines that the first year, and I get it, this is a pandemic, it's a little different, but we were going to give people an opportunity to get used to the changes. I still think we could do something along that lines here. We could say, you know, for now, we're going to give warnings. Who's going to give the warnings? I don't know, but this does give at least the businesses enough cover that they're asking for, as far as telling people that they must have a mask to enter. And they could say this is, you know, village, if it has to be a proclamation or what it needs to be a resolution, then so be it, until we get that enforcement piece down. But then or businesses that aren't practicing this. And the one thing that we do have as, you know, village leaders and stewards of the community, again, we have, and this only, you know, this only applies to people who have certain situations, such as who need liquor licenses or other kind of licenses, or things from us. So, you know, every year, so that we do have that piece, but not all businesses fall under that. So, you know, again, if we're trying to protect the public, we are going towards a place of public accommodation, or where there are people coming and going. That's what we have to keep in mind. So the enforcement piece is really tricky.
Okay.
I agree. We don't want to have the police going, and we don't have, the health department's not going to be able to do this. So again, we could start with something simple and always expand.
Okay. Trustee Carpenter, are you, the 4 points that Nathan talked about, that's what I'm just trying to narrow it down to. If we can get a motion that addresses the 4 points, or one of the 4, if we're comfortable moving with that.
Yep. So my thoughts are changing the minimum age for children from 2 to 4. As a parent of a 4-year-old, I do think of 4 is realistic. This is not, to Trustee Bockhorst's point, to get children back in school, but I think if there is going to be school, most children at 4 will be going to K4. So I think 4 is those two seem to be, in my mind, connected. I do think that masks need to be required in all spaces that are open to the public. And I think that is really the key. Yes, there are some businesses where there are 2 people, and there's some, you know, nuanced situations where, you know, that wouldn't require them to be open, that they're not actually open to or they technically are open to the public, but they are not really seeing public all day. So, you know, I think that is, you know, the exception more than the rule. And so, you know, there will be some opportunity for interpretation. And the point is to change our lifestyles and our habits to wear masks regularly. I do think that we need to change the outdoor distance from 30 feet to 6 feet. And I did just want to clarify, I think Trustee Bockhorst was saying, as far as like the end date goes, it does say that at the end, it goes through the end of the emergency order. So that does give us an end date. And then I also did just want to say that I was looking up the Dane County public health order. Theirs went official yesterday. And they are going to move forward with it starting at 8 a.m. on Monday. So, you know, that kind of can give us some context as far as when we want to, you know, based on when we pass this, when we want that to go, you know, to be enforceable. In regards to the enforcement, I do see it as a complaint-based concern or process. And I definitely understand the concerns regarding the health department. I think if we do not have a way to have some sort of enforcement, this sort of is almost a moot point. So I do think that there needs to be some opportunity to have some enforcement. And if it becomes so cumbersome that the North Shore Health Department is not able to handle all of the complaints, I think that we have an opportunity to come back together as a board. As evidenced tonight, we can do that fairly quickly and figure out and pivot from there. I think that was
Yeah,
everything,
correct.
right? Okay. Oh, you're muted.
I'm sorry, were you in favor of some sort of a monetary penalty, a fine?
Sorry.
Or not?
What did
Just a 50,
yeah, I mean, if there is a complaint,
50.
Sure, that's
on
fine.
the business or the person, or depends on the situation. It's tricky.
I think, yeah, I mean, I think it depends on the situation. And I think, you know, it depends on the frequency. You know, I know that the owner of the daycare was concerned of, you know, children who are not wearing their masks. You know, I think that this is not a, you know, at least this is my sentiment, that we're not out to get anybody, that we're really trying to just make sure would be a safer, healthier place and reduce transmission. So, you know, I think if that is we've had multiple complaints, then there will need to be some sort of monetary enforcement.
This is Ann Christensen. Can I make a point on that, or a
Go ahead.
just in terms of the health department's ability to leverage or to issue citations, we don't have that ability to do. We rely again on the police department for fines related to the food safety code that we have in place. So that wouldn't be something that we'd be able to do. I mean, we could certainly take the complaints. Again, recognizing that the staff of the health department is extremely small and overstretched with just the response for COVID. But in terms of being able to issue citations on people, and it would be a challenge in terms of, you know, a complaint driven and then issuing citations on an individual, because we wouldn't have the direct evidence unless we've observed it or witnessed it ourselves to be able to have, you know, evidence that that would be an appropriate fine. So just those are considerations to have.
I'm sorry, then did you say it would be on the individual or the business?
Well, the way it's being discussed is on the individual. And the business, that would be a challenge too. I mean, it could potentially fall under Wisconsin State's statute chapter 252, which is our public health authority. But, you know, we would need more than just the lack of masks. There'd have to be some evidence of outbreak. And then that would be where we could operate under that type of authority to close any kind of business.
Okay, thank you. Trustee Ursing, please. We're looking indoor, outdoor, age, and enforcement.
Yeah, I kind of echo, you know, much of what Trustee Carpenter had said. I firmly believe that indoor spaces, you know, public indoor spaces, I think 6 feet is a good parameter. So if you're in a business setting, if you're 6 feet apart, you don't need a mask. But if you're interacting with your colleagues in a meeting room, I think masks would be appropriate there. And I think that could go for outdoors as well. So I kind of like that 6 feet, that 6 foot parameter. But, you know, I mean, what Ann is saying, it just makes this makes it really challenging. I mean, how do you prove this to the health department or the police? You know, you're going to have people calling people on other businesses. I mean, this is going to get really messy. And I know where this is, we mean really well here and we have the best intentions, but I could see such a negative outcome to this with residents and business, like residents calling on people and their businesses. It can get really complicated. And where are we going to turn when that comes, you know, when that happens? So I hate to be that guy, but I'm just trying to be, you know, realistic with this. And I can understand, let's say if a bar or a restaurant gets many complaints, the health department can close the Anne, is that right? So you could take away a license or the operating license. Like what can you do as to enforce? What is your
Right. So,
North Shore Health Department able to actually do as enforcement?
yeah, again, it would be under a more of an outbreak scenario where we have evidence of disease, COVID in this case, and that transmission is not being controlled in that environment. And so then we would have, and we don't take it lightly, but the authority to, under a health hazard or again, preventing disease spread, the authority to take action at that point. But not having the patrons wear a mask alone, I don't know if that would be, and this would be for Nathan, enough evidence in court for us to justify just closing down an establishment.
Yeah. That's a really tricky part for me. I can't stress enough how much in favor I am for this as a community. I just, when it comes to enforcement, it's a challenge, right? And but I think if we have signage in our stores, and the business owners are able to explain to their customers that it's mandatory to wear a mask, I'm hoping that gives, that has enough weight for people to wear masks. And I hope that spreads and people, hopefully we can get on top of this as far as, marketing goes and communication, where people understand that they've got to wear a mask in Shorewood. But when it comes down to it, we are not able to enforce this. I do not support the police enforcing this. That is just not their jobs, and that can lead to a lot more, disastrous situations, in my mind. We're dealing with this epidemic of racism right now, and and all we need is more, more disasters in our community around race and now this epidemic. So I'm all in favor of this. Back to your question, indoor, I feel like 6 feet, outdoor 6 feet. 4 to 5 years old is doable. And then enforcement, I'll listen to everybody else here, but I think, I do think the symbolism is a good start, and I know Trustee Amenta does not agree with that. She wants to see, something behind it. I feel like if we can put enough behind the communication of this, in the marketing and the PR, then I think we can really get our message across. It's going to hold a lot of weight out there. So, those are my feelings.
Okay, thank you. I did have one quick question. So we would also obviously need to know cost before we make a final vote. What could the cost be, and what are the availability of masks if we need to make them available, at the Village Hall too? I don't know if, Rebecca, do you have any idea where we would start and how we would start to make masks available for the public at the Village Hall?
Right now the Village Hall is not open to the public. If there is a place that they were going to be, I would suggest the lobby at the Village Center for easy access and walk through. However, we won't have sufficient capability to mask our own people at the level and quantity that's going to be needed. So we would need to look into purchasing, and then the board would need to specify how much they wanted to spend.
Okay, thank you. And then obviously this would not apply to restaurants and bars, right? Because you can't have a mask on to eat, right? And I think Trustee Warren, we're ready for your input on the 4 points. And then Nathan, you have your hand up again.
Thank you. I just wanted to clarify a couple of just technical things. Someone referenced forfeiture, and if, for example, if you place this into the existing chapter 319, which is health and sanitation, in the existing code, there's already a drop-down provision at the end, like there is at the end of most of the chapters in the village code, that has a catch-all forfeiture provision at the end of that chapter. So, and it's a discretionary. I think the minimum's $10 and the maximum's $200 of the forfeiture. So it just says must appear on the ticket, and then there's an amount that will be assessed by the judge. But there's already a sort of a forfeiture baked in, is my point. And then with respect to enforcement, and I'm sorry, Ann, I don't mean to get in the middle of this, and I don't want to take any sides, but under chapter 800 of the Wisconsin statutes, which is the chapter that specifically deals with municipal court, there's a statute that says that departments in a municipality other than the police can issue citations if so authorized by local ordinance. And to give a separate example of why we do that, for example, with respect to building code enforcement issues, we have the building inspectors do that. So we authorize them to issue those citations pursuant to our village code, because that makes more sense, because they understand the building code as opposed to a policeman who doesn't know what the building code is. So we previously used to have them have to issue the tickets, which made no sense. So there is a provision where departments other than just the police can issue citations. And it doesn't mean that if you authorize someone other than the police department to issue a municipal citation, that doesn't mean that the police department can't. It just means that you have more tools in your toolbox, and you've got the option that if the if the health department is directly involved with an issue, that they could issue as well. There's one other point I wanted to agree with Ann on, and there was a broader question of, well, could we shut down an establishment? And Ann and I talked about that this afternoon. The answer is, if the criteria would be met to otherwise shut them down, regardless of whether or not the ordinance existed, then they could. But if it was, if it didn't rise enough to a health crisis where they would otherwise need to be shut down, and if it was merely for a violation of the ordinance, I would agree with Ann that the North Shore Health Department wouldn't have the ability to shut that business down. So I just wanted to add those clarification points in there to assist with the discussion, and thank you for your time.
Okay, thank you. And then before we get Trustee Warren's comments, I just wanted to say, I know there are several people with a hand up. I'm sorry, we did more than an hour and a half of public comment. I thank you for your input. And I hope that you will forward an email to us because we're going to try and get through Trustee Warren's thoughts. And then if we have a motion, we'll work on that. But it's a 20 till 10. So at this point, public comments are closed. Trustee Warren, please.
Thank you. Well, first of all, I'm going to give you my 4, but this is all in light of the fact that I understand that compromise might be necessary here. I do want to move something along tonight and keep the ball going forward. So I'll give my 4, but I very much understand that these might not be the 4 we settle on. So in terms of indoor, I'm guilty of probably not using my lawyering skills here because I was reading public place to mean public place, and I think what we really mean is public place when the public is present. I mean, I think we can fix that pretty easily by just saying public places when the public is present, and I think that solves some of the issues that we've seen here. All that said, indoors, I would not be comfortable with saying you don't need to wear a mask if you say stay 6 feet apart. I guess I personally wouldn't be comfortable with that, and I think outdoors, I've always heard that that the virus disperses better, so I would prefer to leave the mask requirement on even if they're 6 feet apart indoors. Outdoors, I agree with everyone else that I think we want to go down to 6 feet there. Age, 2 to 4 recommendation, and 4+, I would say that we require a mask. And enforcement, I see, is kind of if that's going to be the sticky point here tonight in terms of getting something done, I'm okay with going forward with just having a warning at this point, and then coming back together and figuring out when people have had a chance to get used to this, when it's been communicated, what do we do then? What fines? We want to start at $10, at $50? But I'm okay with kind of starting out as just issuing a warning. I think, some of the points that have been touched on by other trustees where, we have the weight of an ordinance behind a business saying you need to wear a mask inside. Or we have the weight of an ordinance behind saying, if you're 6 feet apart, if you're less than 6 feet apart outdoors, you need to be wearing a mask. I think that says something. And I think that's an important, well, it's bigger than a gesture. It's a law at the point that we pass it. So I am okay with just going forward with a warning tonight, if that's going to be kind of where we go. I know that we might have to tweak that, but again, I think there's a lot of complication. I completely understand kind of Ann's concerns about the small staff and complaint-based enforcement. I don't think we're going to be able to work through that on this meeting tonight. So maybe we do start with kind of a baby step here, and allow everyone in the village to get used to where we are. And then, 6 weeks, 4 weeks, 2 weeks, 3 weeks, whatever we decide, we come back around and we decide, do we want this to become a ticket or some sort of corrective action?
Hey, Trustee Stokebrand, can I just clarify a position of mine in regards to indoor spaces? I believe that indoor spaces should be masked regardless of spacing. So I want to clarify that, not 6 feet. So I misspoke. I'm just like 6 feet outdoors, but everybody indoors should be wearing masks. Sorry about that.
Okay, thank you. So I will wait and see if anyone is ready to make a motion.
Jessica, did you have something?
I started putting something together, but I don't know if this is going to encompass, so I can try and see where that lands us. I move the Village of Shorewood to pass Ordinance 312 with the following modifications. Change the minimum mask wearing age from 2 years to 4 years. Require masks in all spaces that are open to the public. Change the outdoor distance requiring masks from less than 30 feet to less than 6 feet. And then, sorry, hang on. And then the penalty, I don't know what the penalty adjustment should be. Initial penalty, change the initial penalty to be a warning from the North Shore Health Department. It's not.
Trustee Baird, do you have a recommendation on what our motion for that could be as far as enforcement?
Perhaps based upon a complaint.
And you guys, we can't, I mean, can we actually direct the North Shore Health Department to do this, given that it represents all 8 municipalities?
Yeah, I have that question too. Again, I don't know how that's feasible for us to do that for one community. Again,
Village Hall do it.
Nathan, do you have?
I really think you guys can't have the North Shore Health Department be the enforcement agency. We discussed this during the smoking ban as well. And this was brought up that the health department could not be the enforcers of that. This has come up quite a few times in board discussions. So
I agree. Thank you.
Okay.
So we need to say that a complaint needs to go to the police department?
We should just say the village. Just say the village.
Yeah, that's a guy. I agree with that. The village.
And we don't, then we can specify later what the village is.
That's a good idea.
I don't understand. I mean, if is that your motion? Because then I would say, I don't know why we have a separate, I don't know what item D for the village, why that's going to be separate from this. I think we should strike that. Under exceptions, number 1, we'd have to change that person's under 4 years of age, not 2 years of age. Bart also mentioned that he thought this was ordinance 3012, not 312. So can we clarify that we're giving it the right number? And then under F penalty, it says, if we're going to change it just to the village shall enforce this section by giving warnings, is that what we're changing it to? Because I don't know what subsection 1 is. I don't see a subsection 1 anywhere in this ordinance. I mean, I do think we need to be internally consistent to the best of our ability, given that we're writing this at 9:48 p.m. as a group, instead of having an attorney write it and present it to us. So are you changing F penalty to this? This section shall be enforced by the village by issuing 1 or more warnings to either businesses or individuals who fail to comply?
Yes, I would be, yes. I mean, I don't have a second, so there's no need to make an amendment. So.
And personally, I would like, could we just remove mask required outdoors completely with, I just don't see that working.
Okay, can I jump in so we can have this discussion? I'll second Jessica's motion so we can begin to tweak it.
Okay. Excuse me, we have a motion and a second. Sarah, are you able to read that back to us, please?
Yes, I think so. So change the minimum mask wearing age from 2 years to 4 years. Indoor areas open to all public spaces, masks would be required. Change outdoor requirement from less than 30 feet to less than 6 feet. And then change the issuing of warning from the North Shore Health Department to the village is what I got so far. Okay.
Yep. I would be open to amending the motion since we have a second to Trustee Amenta's point regarding the village. Sorry, where did that go?
That's item D.
So,
and I'll note that somebody, a resident contacted me about the police department and whether when police officers are interacting with residents or non-residents, she noticed that they were not wearing masks. So, I mean, this would also apply to police, right? Because in that situation, if they're stopping someone in a car, they're usually 6 feet, closer than 6 feet.
yes, I do believe that would be the case. And I was just going to say regarding the village, that section D, because Village Hall is not open to the public, I don't know that the Village Hall would fall under those same requirements because the building is not open to the public. Now, when the building at some point, hopefully will be able to be open to the public again, that then masks would be required for village employees.
Well, right, but I mean, police officers are village employees, DPW employees are village employees.
Right.
So, I mean, are we requiring them to wear masks when they're doing the route collections? I mean, and if we're having these questions about village employees, I think the other larger operations in town, including public and also, I don't know, Northwoods, and I mean the larger employment areas, Metro Mart, are going to have some of these same questions. So, but I disagree. I mean, if we're gonna establish this mandate for the village, we can't then say oh, but it doesn't apply to us. Like, I think we have to apply it to us. And if we're gonna say, the police are enforcing this, then I kind of think the police have to be more conscious of wearing masks when they can, So.
I would like to make a motion to remove section C, mask required outdoors.
I would second that.
So you're amending the original motion?
Correct. I'd like to remove section C. No mask requirement for outdoors.
I'd like to also
around the table and have a discussion and then take a vote on the amendment.
No, that's not how it works. But I do have some other amendments to make if we are making amendments. Well, that's if you call the question. I don't think they were at that point.
She asked for discussion.
I know we're still discussing. So, yes, I'd like to make some changes as well to this. I know it said in here there was the term date for, it had something to do with when we, was the definition, where is it where the, when this would be over?
I think we need to take action on the amendment that I offered and was seconded.
Can I ask?
Well,
No, we don't.
I'll call the question on.
That's not how it works, you guys.
I'm calling the question.
So we need to vote on to call the question. Sarah?
Yep.
I need a second actually for call the question.
I'll second it.
Okay. Trustee Bachhorst.
No.
Trustee Carpenter.
No.
Trustee Amenta.
Yes.
Trustee Ursing.
No.
Trustee Warren.
No.
Trustee Stokebrand.
Yes.
Call the question fails 4-2.
Thank
Okay,
you.
so-
I'd like to place my amendments as well now.
Wait, you got to take them one at a time. There's an amendment. There's a motion to amend the underlying, the initial motion.
Okay, so we vote on the amendment?
Well,
So
that's what,
now you're in discussion on the proposed amendment to the underlying motion that has been seconded.
so my amendment is to remove section C, mask required outdoors. And we just tried to call the question and it failed. So you want more discussion on the amendment?
We didn't have any discussion on the amendment, actually.
Okay, shall we go around and discuss my amendment to mask required outdoors? Trustee Bachhorst.
I have a point of clarification, Nathan. So if this amendment were to fail, well, actually my question is this: if we want to have additional amendments or changes to this ordinance, how would we do that? Because if we are going to take them piecemeal, or how would that look? Because right now we had one person make one amendment, and then now this is the entire thing without having the rest of the discussion and other additional potential changes to it.
No, I believe we're just discussing this one section.
I'm asking for a point of clarification from the
Sure.
attorney.
No, that's a good question. No, right now you're only deciding whether to amend the underlying motion, and then you would go back to debate on the underlying motion, and then someone else could make a motion to amend the then motion that would be on the table. So you take them in order, because otherwise you would end up with 5 separate amendments all pending at the same time, and whether you voted yes or no, you wouldn't know what you were, you'd have to vote on them all collectively rather than individually. So it won't end debate or discussion on the underlying motion. We're just deciding, or the body is just deciding whether to amend it in this particular way, and others can make motions to amend it when we go back to the underlying motion. So yes, absolutely, you'll have the opportunity to do that.
Is there any more discussion on the proposed amendment?
Yeah, Jessica's raising her hand.
I'm wondering if Chief Nimmer's still on, and if we can get some clarity in regards to the police department and the use of masks with our officers, especially outdoors, and when, pulling over a member of the public.
Yes, I'm still here. Right now, we are currently, it's a employee choice at this point. And we are doing certain things to try to keep our distance, such as approaching from the driver or the passenger side door instead of the driver's door. We're doing those types of things to try to keep that 6 feet of distance. And I guess we've always been going under the CDC guidelines and the guidelines of Ann Christensen that are, for in particular, a traffic stop, the interaction between the officer and the person in the vehicle is less than 10 minutes collectively. And then if we keep our distance of 6 feet, we felt like we've met those guidelines. But again, that's, one thing we've been doing, or a combination of things. Certainly, I think if it's the will of the village to have us do that, we can certainly do that. So we're not against it. So that's what we're currently doing. That's just been the guidance that we've been provided from the health department. Thank you.
Does the union contract affect this at all, Chief Nimmer?
Not directly. I don't know what the impact that the police union would feel about it. I think they would be supportive of that, but I can't be certain that there would not be any type of grievance or discussion from them. But again, I don't think there would be. But again, I don't want to say anything definitively and then that occur. But again, I think our position, or at least my position, is to try to do the right thing. And certainly we've heard a lot about masks being something that can help stop the spread. So if we can do those types of things to help that, we are here to do that. So I think whatever happens tonight, we'll figure out a way to make it work.
Okay, thank you. Any further discussion on the amendment?
I just, sorry.
Go ahead.
Mr. Grant, I just have one more question for Chief Nimmer. Typically, do we have one officer in a car, or do we, if there are two officers in a car at a time, is the expectation that they're both wearing masks currently?
We rarely would have two officers in a car other than field training and other circumstances, but usually it is just one person. We currently have protocols in place at the change of shift that the vehicles get wiped down and do those certain things. And the other aspect is our lobby obviously is open to the public, but the police department itself is not open to the public. And we have been putting all the protocols into place, including the social distancing and obviously sanitizing work areas after those have been used. Thanks.
Thank you.
Okay, is there any further discussion on the amendment? Otherwise, Sarah, could you please call the roll?
Yes. So this would be to remove section C, masks required outdoors in the ordinance. Trustee Warren.
No.
Trustee Amenta.
Yes.
Trustee Bachhorst.
Yes.
Trustee Ursink.
No.
Trustee Carpenter.
No.
Trustee Stokebrand.
Yes.
Motion fails 3-3.
Okay, are there any other amendments, or are we ready to vote on the, go ahead, Trustee Bachhorst.
So what we're voting on is this ordinance here with just the couple of adjustments that we've made tonight. Correct?
Correct.
Attorney Bear?
That's my understanding of the motion that was made. You won't, because of that, you won't have the finished product in front of you, but we would do our best to comply exactly with the motion and then draft and circulate.
Okay, thank you. So a couple of things again that I understand. I'm sorry, I've read this a million times and I can't find in here where it says, I know that the date of when this would no longer be in effect was something, it was tied to our emergency action, or what was it again? I'm sorry.
It's the first sentence under B and C, for the duration of Shorewood's existing emergency declaration order.
Okay, and thank you. And is the declaration order that was determined by the village board, or by whom is that determined?
I believe Rebecca.
By the village board.
Forced, and we voted on it.
Okay.
We adopted it until we end it. So it's in
Right.
force until we look back to end it.
I understand that. So this is what I want to remind those of you on the village board with me right now, is that if we tie this order to that, okay? it puts us in a very tricky spot. Because for a variety of reasons, because we're arbitrarily determining when that date is by this body here. If we tie it to another metric, such as, and I know we don't have this, but if for example, in Milwaukee, they have different phases or different, or if we use something in order, I'm just not that comfortable tying it to that exact thing, because this is an ordinance that we are instituting or adopting based on an emergency order that we've determined as an emergency. Yeah, I don't know if that makes any sense. I guess maybe that's not that clear. So I don't know how to change that to get this passed tonight, but I think maybe that's something that we could determine either later on, or if we want, I guess later on, determine what our emergency order is tied to and put something solid behind it that will limit, not only liability for the municipality, but other things that. And it's unfortunate that we don't have, national direction on any of this. Otherwise, this would be a lot more simple. But I guess that being the case, Nathan, is there anything do you have anything to say regarding what I just said, if that even makes sense at all?
Yeah, well, here's a couple of things. Because we don't have a finished product, this wasn't put through committee previously to start from scratch and then have a finished ordinance for everybody to review and then potentially tweak. Is before you take a vote, I would ask that Ann Christensen, as the representative of the North Shore Health Department, put on the record that based upon her understanding of the amended motion to amend the ordinance, or however you want to call it, that those items are consistent with the purpose and intent of promoting public health and safety. In other words, the parameters that were decided upon at the meeting meet the requisite standards so we can do this. And then you're just going to have to, if you really want to pass this as an ordinance tonight, we're going to have to do our best to make sure that we get the amendments to what we have on paper that was really just a starting point, if you will, exactly right based upon the parameters in the motion, as opposed to directing, again, as I mentioned earlier, the alternative is direct staff to complete an ordinance pursuant to these parameters, and then we bring you back a finished product. And you maybe you have a 2-minute special meeting where everybody looks at it and goes, yep, that's on paper, that's exactly what we wanted, and then you vote for it and you pass it. This is a little bit unusual the way that we're doing this, because again, this hasn't been previously vetted in either a committee of the whole or at a board meeting or what have you, but we will do absolutely 100% our best to get it right, and hopefully it won't need any more tweaking down the road.
Thank you for that clarification. So I guess that is what I would like to make that amendment to do exactly what Attorney Bear just mentioned, is that because yes, going by line on an ordinance that wasn't even, yeah. So how would we do that, Nathan? How would I amend that?
Well, I don't think it's really an amendment to the motion as much as maybe as a discussion point as to whether there would be consensus on, well, I guess maybe it would be an amendment to the motion to change it to direct staff to create to draft an ordinance consistent with the parameters enumerated in this motion, which are A, B, C, and D, as opposed to amending the written ordinance that was to be used as sort of a launching point for discussion, if that helps.
Okay, thank you. And I appreciate that. And I do want to remind others here that, yeah, this is highly unusual to draft something during a meeting. So I forgot, you said it's not an amendment, or it is?
It could be. The amendment, if you wanted to make an amendment consistent with that, and again, I'm hesitant to get it anywhere near a policy decision, because again, that's not my role. But if I'm understanding what you're saying correctly, I think the language for the amendment motion would be to change it from an adoption of an ordinance tonight to directing staff to create and draft an ordinance consistent with the parameters as outlined in this motion.
So moved.
Did we have a second on Jessica's first motion? Yeah, we did, right?
Yeah. Trustee Warren.
Yep, Trustee Warren, seconded. Is there a second on the amendment?
I'll second.
Trustee Ursing? Okay.
I just had one more point. Do we not want to make it clear in here somewhere that restaurants and bars are not included? Because if you're in a restaurant and a bar, you have to take your mask off, right? Is that assumed, or?
They'll have to wear their masks unless they're eating or drinking.
I think
So most restaurants right now in Shorewood are requiring, if you get up from your table, you have to put your mask on.
Okay.
If you're going to the bathroom. So
All right.
if you're sitting down at the table and eating or socializing with your direct party, and you're not eating and drinking, you're required to wear a mask. But if you're eating or drinking, you obviously cannot be wearing a mask.
Okay, thank you.
Right, but if you're at a restaurant with someone who's not in your household, under this, you would need to have your mask on.
And that's one of the reasons I kicked it back to Nathan, which was his recommendation earlier, instead of adopting something here that we don't fully understand or know the implications of. So.
Well, I mean, I actually agree with you, but you know, the special meeting was called, and this is what's in front of us, and it seems like this is what everybody wants to do, and so I'm you know, I'm a little bit perturbed by this issue that I don't feel this has been well thought out, and so I kind of agree with that. But you know, a special meeting was called. This is what's in front of us, and you know, I think if that's how this board is going to proceed, then that's how this board's going to proceed.
Right.
But do we
bring the recommendation of the attorney though? So
can we? Well, he can make a recommendation, but I mean, I don't want to call the question, but I'd like to vote on Trustee Bachhorst's amendment because I have an amendment too I'd like to propose.
Before there's a vote, can I please ask for clarification?
Mm-hmm.
Because I'm still unclear in terms of the village's role from an enforcement perspective. And so before you take final action, I'd like to get
thank you
that understanding, because I don't understand. I'm not clear. Thank you.
I would say in my perspective, Village Hall would write a letter, you know, if there was enough complaints, if there was one complaint, we would send that letter and the complaint to the establishment. And, you know, if it happened multiple times, then we'd have to, I think, cross that bridge when we got there. But hopefully that initial letter saying there's been a complaint, and, you know, right now we have this a mandate and here's the complaint. Can you please, you know, change, or can you please follow these rules and guidelines? And if we get more complaints, then, like I said, we'll have to visit that when we get there. But a simple letter from the village would, I think, be fairly effective.
Yeah. What would you do at Atwater Beach?
You know, I think we'll have to have signage. I think signs and marketing. I think marketing is going to be a big part of this. We'll have to have signs down there. And I do think the lifeguard, since I've recently heard lifeguards are asking people to pick up trash, I think the lifeguard will also have to ask people to wear masks. You know. Wes?
Trustee Warren?
I mean, bottom line for me is if we're going to move forward tonight, there is going to be some ambiguity and we're going to need some process design coming out of this meeting. I just don't think we just won't be able to run down all of these alternatives. I mean, I agree with a lot of what Trustee Ursing is saying, you know, that we'd have the letter come from Village Hall, but we're not going to be able to adequately design all those things during the course of this meeting. So if it's the board's will to move forward, then we'll have to get in the weeds there. But I don't know that we're going to be able to effectively do that at this meeting. That's not saying I'm not comfortable moving forward. It's just I don't know that we're going to be able to design all the processes we need right now.
Right. It's just that Manager Ewald was asking how enforcement was going to work, and so we were trying to resolve that. The other thing we don't have in here is any timing, and so Trustee Ursing just talked about the importance of marketing. I know we already have signs at the beach that talk about distance, and the memo from the staff says they would need time. Are we thinking about maybe like the last week in July for this, and then we have another special meeting and vote on it again? Any Trustee Bockhorst?
So yeah, if my amendment passes, we effectively tonight have at the very least, a statement to the public saying that we are moving in the direction of an ordinance with details to be filled in. And then we will have these questions answered. So the one thing that I would be really reluctant to do is to pass, just because this is in front of us, this is this hasn't been really vetted by anyone. And like I said, the city of Milwaukee isn't even using this at this point. So to remind people, I want to get something done tonight as well, but I want it to be at least not half-baked. And again, this is a very unusual process how we're doing it right now. So so yes, we still could have another meeting. We could put a time limit or ask staff when they could have this back to us, and then vote from there. So I just want to remind people that my amendment is not doing anything other than pushing this forward with allowing us to have some substantialness instead of passing something that we don't all agree on.
So, I mean, can we ask, I mean, I don't know what is realistic and what is, for staff as well as for us to come back together in a timely manner. Because I do think, well, I definitely agree with you. I want to make sure that we're, that this is well thought out and that this is plausible. I also think that, every day counts. So, I don't know if Rebecca or Sarah or Attorney Bayer can answer that, as well as that we as a board are going to be able to quickly come back together.
Can I say something?
Trustee Aminta?
If this had been agendized as a cow for discussion, then that would have been appropriate for us to, give our ideas and have a back and forth and then come back for adoption in a week or a couple days or whatever. But that's not how it was agendized. So we have been put in a position of either taking action on a pandemic, on an emergency, or looking like we're not taking action. So I agree. There's a lot of defects with this. I think the village manager has and our director of health have raised a lot of questions about it. But at the same time, we're now in this position because of how this was agendized and how this was presented. So I'm in favor of going ahead and adopting it, and be what may. Where are we? Are we voting on amendment? The amendment failed, correct?
The amendment on removing the outdoor failed. Now we're right now we have Trustee Bockhorst's amendment that is guiding staff to complete an ordinance pursuant to the parameters we've discussed. So we would not. That is what we'd be voting on.
Okay.
And then, so in my understanding, and we would not approve an ordinance tonight. Is that correct, Attorney Bayer?
Yeah, if her amendment passes, right?
Right. I mean, essentially, as Trustee Amenta referenced, this really was, for all intents and purposes, a committee of the whole, because this is really the first time it's been discussed. And based upon the parameters that you decide, we can put that together in a final ordinance and fit it into the existing code. And again, the way if you called another special meeting, it might not have to be more than 2 minutes. I move to approve the now drafted ordinance, and you adjourn, and everybody goes home. And but at least you'll have in front of you what is the final product, and know exactly what you're voting on.
Okay, my final question then is, do we wait until the August 3rd meeting? Because would it, although we could approve it sooner, but how long, you're talking about all the community, we need a whole communication plan. You'd need to have, you know, the signs made and.
That's not true. That's not true.
But we could just, so we could just, well, we can vote on the amendment and deal with timing later. Is that the will of the board?
I'd like to vote.
Okay. All right, Sarah, would you please call the roll on trustee Bachhorst's amendment?
Yep. So this would be to change from approval to direct staff to draft an ordinance consistent with the parameters in this motion, and then to come back with the final product. Trustee Carpenter.
No.
Trustee Ursink.
Yes.
Trustee Warren.
No.
Trustee Amenta.
No.
Trustee Stokebrand.
Yes.
Trustee Bachhorst.
Yes.
Motion fails 3-3.
Okay, I'd like to propose an amendment to remove the section D, mask required for city, village facilities and employees. I think whatever we approve here, what's good for the goose is good for the gander. It has to apply to the village.
I'll second it. Is there any discussion on the amendment? She'll go around the table. Trustee Bachhorst?
Is this for discussion?
Yes, on the amendment made by trustee Amenta and seconded by me.
So this is, you guys know, going to be a lengthy thing because we're going to make amendment after amendment. So no.
Trustee Carpenter?
Sorry, going back and forth. So just to clarify, so it, you know, in at DPW, they're currently not open to the public. I'm just trying to make sure I'm understanding. So for village employees at DPW or Village Hall that are in spaces that are not open to the public, we are not requiring masks, but if they are, once they are open to the public, masks will be required. Is that the intention of?
They're outside, they're working outside. And they may very well be within 6 feet of each other or.
Okay. So, so if there are two DPW employees that are working within 6 feet of each other outside, a mask will be required.
Well, that's the ordinance that's presented here, yeah.
Yep. Okay.
And the same ordinance would apply.
Everyone, yep, okay, thank you.
Trustee Ursink?
I will vote yes.
Did you have any questions on the amendment to remove section D as special dispensation for village employees?
I'll agree to remove it.
And
Trustee Warren? Any questions?
Yeah, I'm just trying to think through, is this, I guess this question would be for Rebecca, is D there because, you know, we do have some facilities that are not necessarily open to the public. So we want some deviation from the standards set forth herein.
Just to be clear, I had no part in the drafting of the ordinance. So I'm not sure why it's there. I was not consulted on that, so.
Do you see any need for it?
I was curious as to why it was there.
Okay, and I will vote to remove it. So if there's no further discussion, the amendment is to remove section D. Are we ready to call the roll, or would someone Does anyone else have anything? Okay, Sarah, please.
Trustee Stokebrand,
Aye.
Trustee Ursink,
Aye.
Trustee Amenta,
Aye.
Trustee Carpenter,
Yes.
Trustee Warren,
Aye.
Trustee Bachhorst.
Yes.
Motion passes 6-0.
Any other amendments, or are we ready to vote on the ordinance? Trustee Bachhorst?
Yeah, I'd like to make a couple of amendments here. Can I make them all in one? I think I can. Okay.
You know, my guess is it's probably a little easier for the clerk if you do them separately. How many do you have?
Well, I don't know yet, so I'm going to ask that of the clerk and of Nathan. What would be the recommendation?
Probably
Sarah?
depends on what they are. What's
Nathan,
the nature of the?
Nathan, could you please?
Sorry.
I would
Alright.
say probably one at a time would be the easiest.
Okay.
Just in case somebody doesn't agree with one, but they agree with the other. It's just an easier vote to record.
Okay.
I concur.
Okay, thank you for that. Whew. All right, and are we going to deal with the, well, that's another issue, if we're going to deal with the vocabulary around indoor spaces, public spaces, you know, all this stuff. So there's a lot to be worked out here, I hope you all realize. But
Can I ask,
Yeah.
can we take like a 5-minute break and then maybe Trustee Bachhorst can have a little time to get her notes together? We can just take a 5-minute break.
yeah, I'm fine with that because I was not expecting us to be going through this word by word, but yeah, fine with that.
Okay. We'll take a 10-minute break and we'll reconvene at 10:35.
Can we make it 5?
Can we do a 5-minute break?
10:31.
Perfect. Thank you.
Thank you.
Okay, is everybody, I see trustee Amenta's not back yet. And is Sarah? We'll take another minute. I don't see, oh, there we go. Okay, Tammy, you wanted to make an amendment?
Tammy,
You're
you're
muted,
muted.
muted, trustee Bachhorst. Sorry.
Oops, sorry. Yes, I do want to make an amendment. And I also just really quickly, I'm sorry, but I need clarification on this. This will help me determine the amendment. The changes to this that were proposed by trustee Carpenter in her motion, other than the age, changing the age from 2 to 4, was it?
Yeah.
What else?
From 30 feet, 6 feet.
Sorry,
Six
can I have one person?
Yep, so it was change the minimum age from 2 to 4, change indoor areas open to the public, change outdoor requirement from less than 30 feet to less than 6 feet, and then change issue warning by North Shore Health Department to issuing it from the village.
Okay, thank you. Does that last one, does that include, is that the penalty section, or is that just the last part of that? I mean, is that the last part? Where am I at? The health department, that doesn't cover the penalty though, correct?
That's the penalty.
The penalty, I believe.
So,
Yep.
So what does that mean then as far as the penalty is concerned?
They get a letter from the village, a warning from the village with the complaint.
Okay, thank you. That's what it means? Then
Yeah, that's what it means.
Can I say, I don't think the village can, based on, the village has to investigate a complaint. The village can't just, if we get a complaint from the public, then send a letter. That's not really, because anybody can complain about anything. It doesn't mean it's true or justified. And I don't think the village can act based solely on a resident complaint.
I just want to, sorry, this is Rebecca. I just want to be clear with one thing. Number one, I am supportive of wearing masks in appropriate environments. I do want to strongly advise that there is not a practical way to do investigations on complaints that come in. There's not practical methods to enforce on this in place, nor the bodies to do that to a detailed level or degree moving forward. And I'm not saying that to be discouraging. I'm saying that to be practical and also to manage expectations, because our community has a large, diverse, varying degree of expectations. And so I am, I think that the general, thrust that brought this meeting to be is one that's positive. And I think that, quite frankly, it was really wonderful just to see the community involvement tonight from those people who felt strongly and really did it in a very positive, brief, concise way to help the board. But I just want to be clear, because we need to be clear on what those expectations are. Thank you.
Perhaps we want to make, should we make it self-enforceable?
Well, Okay. All right. So I hear what you're saying, but my amendment for this time, this is really small, but I think under C, the last line where it says, whenever the person is in an outdoor public space and sees a person within 6 feet who is not a member of the person's family or household, I think that we say, I think that's too restrictive and again, and not probably the proper nomenclature. I don't know how to make that more vague. Maybe the person's coterie or I don't think we can just say that that you have to be within someone's family or household.
Can I make a suggestion on the approach for that?
Carpenter, go ahead.
Sorry to interrupt, but I wonder if we could say like social circle. I don't know if that's the right terminology, but I know that there has been some social discussion as far as, I think Trustee Bachhorst, you were mentioning it before. There are some people who, if you're single and this person's single, that you both agree that you're each other's only social connection.
Right. I mean, family is a determined. It's let's just go prior to gay marriage, right?
Mm-hmm.
That this two people. Well, it wouldn't matter if you're unmarried. You're not allowed to be. It depends on how you define family here, and I wouldn't want that to be the sticking point for people to say, "Hey, Trustee Bachhorst and so were together, and they're not in the same family or household," because that's not really anyone's business.
Could we call it someone's COVID cluster?
Mm. Yeah.
Cluster seems to be a word they're using a lot in, I don't know, just throw that out there.
I was going to throw it. I like kind of combining previous social circle.
Mm-hmm.
Okay, so Trustee Bachhorst, do you have an amendment then? Are you ready?
Sure. Scratch the last section where it says who is not a member of the person or family or household. Scratch family or household and put intentional circle.
I'll second that.
We have a motion and a second. Any discussion? So we're changing not a member of the person's social, I'm sorry, what was it?
Scratch family or household and then put intentional circle.
Sarah, do you want to call the roll?
Sure. Trustee Amenta.
No.
Trustee Warren.
Aye.
Trustee Bachhorst.
Yes.
Trustee Ursink.
Yes.
Trustee Stokebrand.
Yes.
Trustee Carpenter.
Yes.
Motion passes 5-1.
Did you have another one, Tammy?
Well,
Bachhorst?
I guess I'm going to leave this vague, but E4, and maybe this was intentionally vague when it was originally drafted. So persons in settings where it is not practical or feasible to wear face coverings, that's, as we all know, is pretty dang subjective, but I'll leave it alone. Nope, other than, yes, I do. So I guess I'm still clear. I'd like to just scratch F, if that's possible, the whole penalty thing. Unless I still am unclear as to what is being left in this paragraph here, if anything.
I don't think there's anything left in that paragraph.
So we could scratch items F. Is that what we're saying? Or that was already scratched in the original motion?
I don't think it was scratched. It was just replaced by, we were just considering a letter from Village Hall, but that, from doesn't sound like from Rebecca's standpoint of view that would be recommended.
Well, then I would like to know what was recommended in lieu of this paragraph, if anything. Otherwise, I'm going to proposal?
I don't think we got to the next phase. You know, we kind of went through North Shore Health Department, we went through the police department, now we went through the village, and we've all got the same sort of recommendation from each organization. So now it seems fairly open-ended at this point.
Do we want an amendment to remove section F penalty and make a section that calls for self-enforcement?
Well, I'm not sure I would
you define
say
self-enforcement?
What's that?
How would we define self-enforcement?
Yeah, I would say that instead of penalty, I would rename it enforcement. How about that? Will be determined, something along those lines. Again, this is a very, Nathan, do you have any recommendations? Just so the public knows, this is not typically how ordinances are drafted. I think that is important to state. So forgive us if we seem to be fumbling on this, but this is atypical.
That's okay. I was having some technical problems for there and you cut out for a moment, so I wasn't quite sure what the question was.
For F, penalty, I think that we're unclear as far as what we wanted to do and how it's to be enforced. So how do we make this vague? How would I rewrite this to say something along the lines of enforcement or eliminate the whole thing? We don't have a consensus on what the fine nor the future kind of method of enforcement would be.
Could we say that for the time being, the village is we have decided to make it a self-enforcement policy?
Yeah, I mean, I guess that's more of a policy question than a legal question.
Yeah.
If I could
go around the table, everybody. Go ahead.
Can I ask a question? As
Trustee Amenta?
I mean, I think we have to decide, do we want to pass this with no penalty or enforcement provision? But if we do want a penalty and enforcement provision, although it seems like we're getting answers from staff that are like, there doesn't seem to be any opportunity for that. But if we do want to try to work something out, then I would move to reconsider the vote on Trustee Bachorst's amendment to take a little more time and return for a second meeting to where we can work some of this out. But I guess I wouldn't make that motion unless I hear that people definitely feel we need to have a penalty enforcement provision in here. If people are okay with not having it, then I think we can continue tonight.
Should we go around the table? Trustee Bachorst?
Well, Ursink has his hand up.
Trustee Ursink?
Would it be best for us to just pass this without a penalty tonight and then continue working on it, so then we can, you know, over the next week or so, we can figure out what that penalty is? Because I think it's going to take us at least, you know, a couple weeks to get a week maybe to get this in place from a staff perspective. So hopefully within that amount of time, we will be able to work kind of these details out behind the scenes. I would hate to then just wait a week to pass this whole thing, because, you know, it's going to keep pushing it down the line a little bit. So I feel like there's urgency to pass something right now. And I think if we could pass this without maybe F at the moment, and then revise F in a week or revise F in a couple of days, you know, when we get a better idea of what we can do and what the village staff can do, I'd feel comfortable with that.
Okay, can I just clarify? So you're saying you want you do want a penalty or enforcement?
I'm saying what I'm saying is I'd pass something tonight without penalty or enforcement, with that scratch from this you know, the ordinance.
Okay.
Can I ask the clerk? Did Trustee Ursink vote in favor or against Trustee Bachorst's amendment?
I voted in favor of it.
Okay. Okay, then I'm going to move to reconsider the vote on Trustee Bachorst's amendment, which was to
direct
staff to return, yeah,
to complete an ordinance pursuant to the parameters that we've discussed.
Yeah, I'll move to reconsider that vote.
I'll second that. Can you call the roll, please? Or was there any more discussion on the motion to reconsider?
I think Trustee Carpenter has a question.
I just have a question for staff. Is coming up with a penalty, I mean, is there an option for enforcement that we can work together on? You know, I'm feeling really frustrated at the moment as far as enforcement goes. I feel like it's necessary for this to be productive, but I'm concerned that we don't have an option, even with more time.
I'll start by saying I agree with your frustration.
So do I.
You know, because I don't want this to be misinterpreted to the fact that, you know, staff does not want to help. I think that there is a genuine desire on everyone's behalf to try to do the right thing. But again, it's the management of expectations. And I share that really from the perspective that, you know, on a day-to-day basis, I hear a very level degree of expectation from residents and people who are within our community. And so I don't have any type of magic bullet here to help that's going to come in and save the day. But I think from the board's perspective, you need to have an understanding and agreement from yourselves in terms of what that will be. And while I know, we talked about the staff department having short resources, and while we have more employees, we still don't have a significant number of people, who to manage this level of, it's almost like setting up a hotline, from a response perspective, something like this has to be dealt with in the same manner of which, and I won't step in front of Chief Nimmer from this conversation, and I'm not minimizing the pandemic by any stretch of the imagination. I have no intent to do that. But we have limited personnel, we have limited staff, and I fully anticipate receiving calls randomly and from people who may not know each other. From a staff perspective, this afternoon we had a discussion of, what happens when someone becomes angry, when even entering our facilities, which is not a new topic. We have an opportunity to ask them to politely leave, but there really needs to be a level of agreement from the board, and then an understanding of what financial resources you want to put towards that from a reallocation of time.
Trustee Stokbrand.
Go ahead, Trustee Warren.
So, can you hear me?
Yep.
So Rebecca, just to drill down a little bit on that, just to ask kind of in a pointed way. So if we were to reconsider and then approve Trustee Bachhorst's amendment, would an extra few days to pull this back out and work on the enforcement section, would there be something where you feel like you could design something where we could set the appropriate expectations? I do understand the resource constraints. I totally get that. So we'd want to set expectations in line with those constraints and design an enforcement mechanism that works, whether it's warnings or fines, limited investigation, talking about education, something. I just want to make sure that if we do delay this, then we don't come back a week, 4 days from now and have the exact same conversation about how we're not equipped to enforce. I just want to know if there's if there's anything kind of percolating in your mind where you can think through a solution, in light of the resource constraints that we're going through, which I totally recognize.
I didn't think Trustee Ursing's suggestion was bad.
Well,
send a letter. If someone has a complaint, have them fill out a form. We will be happy to educate people on the opportunity to wear masks and how we believe that that's positive, not only for our community, but in every community.
And so just so I'm clear on this, so someone calls the village hall and says, I saw John Doe without a mask on and we don't know his address. You know, I'm just trying to figure out how this would work out.
And it goes nowhere. You know, I mean, that's not enough detail. It's just, I mean, it's just, we're only sending warnings. You know, there's really no enforcement except for warning letters. So I think our staff would say, thank you for the complaint. We'll investigate. If you have any further information, please send it to us. But if it's John Doe and there's no information, there's nothing anybody can do about that. You know, if it's one of our bars, that, you know, and there's multiple complaints, then, you know, there's more that we can do with that. You know, we can educate. And I think passing something tonight with no enforcement, there's plenty of orders that are out there that have no enforcement whatsoever in them. You know, and if we can at least have an enforcement where our village hall sends a letter of education to a resident or, you know, a business, that's great. You know, I mean, I think I'm perfectly happy with that. I just don't think we can wait too much longer. And I probably would not vote yes on Trustee Bachhorst's amendment at this point, or not amendment, Trustee Bachhorst's amendment at this point. Again, because I'd like to get this passed even with no enforcement or the enforcement of a simple letter of education.
So then do we, so there's the motion to reconsider Trustee Bachhorst's amendment. We need a vote on that. Does anybody else have any discussion? I would
Did
put
anybody
out.
second it? Was it seconded?
It was. Trustee
We did.
Stokebrand seconded.
Yeah.
Oh, okay.
So I do think that the county decided they would try to enforce, or I'm sorry, is the city going to try to enforce indoor public places, but outdoor is self-enforcement? That would be one option, where you would have a little more, you could put some parameters around it. I don't know if anybody else feels like doing something like that. No. Okay, should we vote on the motion to reconsider? Sarah, would you call the roll, please?
This is to reconsider, to change this from approval tonight to direct staff to come back.
Correct.
Trustee Amenta.
Aye.
Trustee Ursink.
No.
Trustee Stokebrand.
Aye.
Trustee Carpenter.
No.
Trustee Bachhorst.
I have a point of clarification on this. Sorry, guys. Attorney Bear, if I vote, if I were to vote no on this right now and I'm on the prevailing side, then can I reconsider this again?
Okay, so I'm looking at the existing ordinance, which is 15517. Okay, that it shall be in order for any member voting with the prevailing side to move for reconsideration.
Okay. Yes.
Trustee Warren.
No.
Motion fails 3-3.
So we're back to the original motion. Do we need a motion then to remove the penalty section completely and just?
Yeah, I will move.
Otherwise, staff has no direction.
Yes, I will move to remove item F under penalty. And unless anything else is needed, that I need to say anything else on that, Nathan, I'll just remove item F.
I'll second.
Yes, question.
Okay, discussion. Go ahead, Trustee Warren.
What is Nathan? What's the upshot of that? Is that you said that there's a catch-all penalty section at the end? Is that just a purely discretionary? Because maybe that's where we want to end up, where we have a completely discretionary penalty section, where we can kind of think through what kind of penalties are appropriate. Yes, the answer to that question is yes. And if you give me a moment, I'll go to the exact provision and I will read it to you.
So chapter 319, which is where this would be put, has a 319-13 provision, which says, except where a penalty is otherwise specifically prescribed, the penalty for violating any provision of this chapter shall be as set forth in section 115-1 of the code. And 115.1 has a discretionary forfeiture amount between the minimum and the maximum, which is $10 and $10 and $2,000.
Aye. Ooh.
Is that completely discretionary?
Then.
Do we have to assess the $10, or is it completely discretionary? Is it a shall or a may?
Well, there's two levels of discretion. One is whether or not to issue the ticket.
Okay.
Period. So if no one issues the ticket, then there's no issue. And then if a citation is issued, it's up to the municipal judge as to what to impose based upon the circumstance.
So it would give complete discretion to go either do nothing at all up to issuing a ticket, but there would be complete discretion as we kind of felt our way through this process.
Yeah, I mean, if by nothing at all you mean $10, yes, that's right.
Well,
yeah, I mean that's the minimum. Or I guess theoretically the judge could just dismiss it too, right? Yeah.
Or if we don't have to issue a ticket at all, though. I guess is what I'm saying.
I'm sorry, could you repeat that?
Under that provision, we don't necessarily have to issue a ticket. We could not issue a ticket at all.
Right, right. Whoever the issuing agency is or whoever the investigating agency is always has the discretion, depending on the circumstance, just as an officer would have the discretion to pull somebody over for speeding and give them a warning as opposed to a violation.
Okay.
Okay, Trustee Amenta?
Okay, so if we adopt this and it becomes part of our municipal ordinances, and I see a 5-year-old without a mask in violation of this ordinance, and I call the police and ask that they issue a citation because this is in violation of a municipal ordinance. I mean, what is it? Is the police not obligated because it's a violation? Just like, for example, posting something on a lamppost or a tree, for example, is a violation of municipal ordinance. And I know someone who was arrested for that. So if I'm asking the village to enforce an ordinance, does the village have an obligation to issue a citation?
I mean, there's always discretion on the enforcement side. That's up to the individual officer in the field, depending on the facts as they find them pursuant to the investigation, I guess.
But I mean, we have an ordinance against public urination. I mean, let's assume we do. I mean, I'm just saying, if we're passing an ordinance and it's part of our ordinances, why are we passing an ordinance that we don't expect anyone to abide by? I guess is my question.
Well, I think that in most cases, if and maybe Chief Member can address this, but I suspect that in the vast majority of cases where, the department finds someone in violation, a clear violation of the code, there's a citation that's issued. I mean, that's just the general policy. But if there's a new policy like this and there's direction given, to the department that during a grace period, if you will, we want to handle these through education and warnings, as opposed to, initially writing tickets right away. I'm sure that, you could work with the chief on that, and I would defer to him on that. But
so my only point is that the police department is responsible for enforcing municipal ordinances, whether that's someone who posted a notice on a tree, or whether that's someone who is urinating in public, or this ordinance. So I think that our residents have an expectation and a right that we are going to enforce this ordinance just like any other. Now, whether they give a warning or whatever, that's fine. But I don't think we can pass an ordinance and with saying that, the residents do not then have a right to expect the ordinance to be enforced.
Can I ask a question?
Go ahead, Trustee Warren.
So building on that point, so is the upshot of removal of F that then then enforcement would fall to the police department, would have discretion to write tickets or not, and the tickets themselves would be from $10 on up. In other words, if we take out health department, take out village, does it default then to the police?
Well, what would be written on the ticket would be must appear. If it's just a range as opposed to a specific forfeiture amount, it just says must appear in court, and then the judge would have the discretion to impose between the two extremes based upon the individual facts of each case.
But the police would be the ones writing the ticket, though.
As opposed, they would write the ticket. That's right. Yeah.
As opposed to say if somebody, you wouldn't call the building, the zoning department if you saw something in a restaurant. It would fall to the police, and then it would be up to the officer responding to decide if he or she wanted to give a warning, right?
Well, the police can always issue citations for violations of the municipal code, but in Chapter 800 of the statutes, you always have the option of assigning different departments who may have a specialty in a particular area. You can always authorize them by statute to issue citations, which is, for example, what we do with our building inspectors, because obviously they know the building code more than a police officer might. So when they go out on inspections and they find properties that are non-compliant, they have the authority under our ordinances to write tickets. And that's what, if there was a different entity or department that you thought was appropriate, you could bake that into the ordinance itself.
Okay. So are we ready to vote on the amendment to remove section F as in Frank?
No, because it's very unclear to me then, because then we have to issue potentially a $10, and we're saying that the police are the enforcement agency, no longer the village. Is that right?
Well, the police are employed by the village, and it would be up to the discretion of the responding officer.
I understand that, but this is contrary to what we discussed about an hour or so ago as far as enforcement is concerned. So it wasn't the intention of my amendment to make this fall on the police as far as enforcement was concerned. Trustee Ursink has his hand raised too.
So
Trustee Ursink?
Can we bake this into the penalty section that the penalty is Village Hall's responsibility to send out a letter that we have, like a template letter that's essentially education about wearing masks and what we expect from the community? Can we write that into this, and then it falls on us?
I guess it would depend on if if the Village Hall got a name and an address, but we said there's no investigative piece, right? Without the police being involved, there's no investigative piece.
Right.
And I guess I'm not comfortable with that. I guess just a letter of warning for something we think happened.
I'm not comfortable fining people for something we think happened either. I mean, due process by any means, but I'm also not comfortable with increasing police presence in this regard. I mean, this is very, you guys have to realize this, that.
Yeah.
So what I'm hearing is if we remove penalty, then it goes to the village code and directly the fine is minimum $10 unless the police, and then it becomes a police issue. And that's not my intention. So I either need to withdraw the amendment and ask unanimous consent on that, or actually that's what I need to do. I'm going to withdraw my amendment. Who seconded it?
I think I did.
That's correct. Yep.
Withdraw my second?
Yep.
Okay. So everybody that wants to move forward on this tonight, how are we going to deal with the penalty phase? Or are we going to?
I think it needs to be unanimous consent by the rest, doesn't it?
Okay.
I thought someone had asked for unanimous consent and I didn't hear any comments, so.
Oh, okay.
Maybe I'm wrong.
Forgive me.
Okay.
Okay, I think we're good to go then. So we're still stuck on penalty. For those trustees that want this done tonight, how do you want to deal with the penalty? We'll go around the table. Trustee Amenta?
I'm gonna have to pass. I don't have an answer.
Trustee Bockhorst?
Yeah, I'll pass.
Trustee Carpenter?
I think going back to what Rebecca had said regarding a letter at this moment seems like our only option. I echo those same concerns that Trustee Bockhorst had said previous. I also wonder to Trustee Stokebrand, your point about, I saw John Doe and I happened to be at camp. If there's an opportunity for us as a village to not just send the letter to John Doe, but also to camp and reminding, the bar that this is also something that's important for them as well as for the resident. So I don't know if that's, in that section F, that is where we would include that. But I do think that at this moment, that really is our only option.
Okay, Trustee Ursink?
I mean, I'm going to agree. I think that, if we're trying to put something into this piece here that is that is a penalty. Village Hall gets emails every day. We all get emails every day, and I think Rebecca and staff do a great job of replying. Sometimes it's a boilerplate, sometimes it's a little bit more in depth. But I think if we act like that, I think that's a good first step, and I think that's gonna get this thing passed. I refuse to vote for anything where the police are involved. That is not something that I will get behind. I think, I think our best bet is to work with Village Hall to send letters to either businesses or residents, kind of explaining our stance and educating.
So this will be with no enforcement. We'll just say, we heard you did this and we're sending you a warning because we think you did this, right? I'm just saying, why don't we just make it self-enforceable? We're making this ordinance self-enforceable.
Well, and I have a question about that too. Are we gonna put the name of the person who reported you in the letter?
Yeah,
I think an anonymous system that would be.
I think we should, because
Yeah.
I think if we have an anonymous system where anybody can call and report on anybody, and have Rebecca send out a letter saying, just to 6, you didn't wear a mask.
I figure, in my perspective is it's more business related. It's not so much. I saw Trustee Bockhorst with, sorry, Trustee Bockhorst. I saw, with John Doe, they weren't wearing
the
the mask.
first one here ever to wear a mask of you guys, so please use me as an example.
But
if that's how you see it, then you need to modify the ordinance to reflect that.
I just don't see how we can, because then
But you can't just say in a meeting, this is how I see it. You have to change the wording of the ordinance that we're adopting.
Can I say something on the enforcement?
It
So from a perspective of phone calls, it is not going to be that this business is doing this. It is going to be, I saw my neighbor have these people over, or it is going to be a level of phone calls that we may not have all the answers to, and we may not have names, but it is going to be a huge level of, I saw this person on the street, or these 5 people, they didn't look related. So just so you know, it will be that.
And never snakes back around to me. I just want to offer my 2 cents. We could do a couple things. I mean, I think the letter is the best idea. We can also put, if feasible, in the ordinance itself. If you get a call, 5 people were walking down the street, not socially distanced, it's obviously not feasible to send a letter. My other thought is the letter doesn't have to be a nasty gram. As an attorney, I've written my fair share of those. It doesn't have to be that. It can be very much we received a complaint. We don't have to pass judgment. We can just state factually, we received a complaint about social distancing. Here are some tips and here's some education around it. It doesn't need to be a nasty warning letter. So there are options here.
Okay,
To Trustee Warren's point, I thought it would be a positive point of education.
Right.
At least I think that's one thing that has really hit home to me tonight, and the way that some of the citizens really here have gone out of their way to try to reach us in the best way through an educational format. You know, I just think it was a powerful tool.
Okay, Trustee Ursink?
You know,
Your hand raised?
I would hate to do this, but if we went back and simplified, and I'm going to go back to the beginning, kind of where I started, if this was purely about indoor businesses, and I know I voted against the, you know, excluding the outdoors, but would this simplify everything if we just focused on indoors, right? We all know outdoors is the same pandemic as the indoor pandemic, but I think for us to enforce indoors might be a little easier than you know, Kathy and Judy walking down the street not masked up, you know, and then people ratting them out. I just that's just crazy to me, you know, and I know it's going to happen every day, all day long. So if we can just stick to businesses and public, you know, spaces, indoor public spaces, that might be a lot easier than to send out letters to those spaces. So that'd be something I'd be open to.
Okay, that was the point of my amendment, which failed. So, you know, someone else would have to reintroduce that. Then I think the letters would be much more, it'd be much more workable. It would be more feasible.
Well, someone on the winning side of that vote can move to reconsider, but you and I voted in favor, so.
This is Village Manager Ewald. I do think that, you know, this board has always been supportive also of starting someplace and working into it. And I think that may be a really pragmatic place to start. It's really challenging to do this all in one night. You're also, right? I'm looking, I mean, everyone on this camera looks, I mean, there's an exhaustion factor here, but you know, I'm hearing the intent that you wanna, except for Wesley, he's smiling there. Like but you know, it could be a really positive place to start because we're gonna learn a lot. That's called normal.
Are you saying indoors, Rebecca? Are you saying that, you know, this would be a good starting point would be to focus on the indoors right now? And
indoors open to the public.
Indoors open to the public. I would reconsider. I move to reconsider my vote about outdoor spaces.
I'll second.
Can you second, Trustee Menta?
Yes.
Okay.
Okay, Sarah, can you please call the roll?
Yes.
If you want, you can just ask if there's unanimous consent to reconsider.
Okay, is there unanimous consent to reconsider removing masks required outdoors? I vote yes.
Unless there's anyone opposed, you're all set.
Jessica, Wesley, Tammy, trustees?
Yes.
It appears to be unanimous consent. Okay, so then can anybody make the motion?
Oof.
Wait, to remove that item?
Correct.
Now you're reconsidering the underlying motion again. So what was the underlying motion that's now being reconsidered?
To remove section C.
Yep. So that's back on the table.
I mean,
Trustee Warren?
I will go back to what I said about 2 hours ago. You know, in my ideal world, I would want this in. However, to get the ball rolling here, in light of what the village manager has said and what I'm hearing on this call, it might be more feasible to just start here and see where we go from here. So I'm still turning it over in my mind, but if this is something that allows us to get something done tonight, I'm certainly open to it.
Yeah, that's great.
I feel the same way if this allows us to get something passed tonight. Rebecca, could you clarify if we, you know, because our next regularly scheduled meeting is August 3rd, almost a month from now. If we wanted to have that on the agenda to add outdoors, once we've, you know, been through a month of this, would we have to go through the future items for consideration and then have, you know, be on the next meeting and the next, you know, or would we be able to get it on the August 3rd meeting if we wanted to?
My suggestion would be to review it in August. I mean, because there's been some suggestions tonight of the fact that even if this is implemented tonight, there's a lot of communication that needs to occur with people within the community. I know tonight, like, we feel like we've reached everyone, but I still question whether we have.
Oh yeah, no, I definitely agree. You know, even though there was 100 and some odd people on the call, we obviously have not reached everyone in the village. But I just want to make sure that if we are gonna, you know, on August 3rd, if we could have the opportunity to, yeah, maybe have a review and a recap from staff as to how things have, you know, have been going up until that point, and then we would also have the opportunity to potentially add in section C if, you know, everything's going swimmingly with indoors and we want to sort of layer on outdoors.
That's really up to you as a board tonight to provide that instruction. You know, if you want to list it, then we'll list it.
Okay. I mean,
having done your agenda today, we have a packed agenda. So it would be good if there is some consensus amongst the group in terms of.
I'm good with the review.
Okay. I mean, I would feel comfortable moving forward without outdoors if we have that option to review at the August 3rd meeting.
Okay, then do we need a new motion, or we're just reconsidering the previous motion, Nathan?
The previous motion is now back on the table for reconsideration.
And I don't need a new motion. Okay, so then the motion is to remove section C. Sarah, do you want to call the roll? Unless someone has their hand up, are we ready to vote?
Yeah, let's vote.
All right.
Sarah, can you please call the roll?
Trustee Carpenter.
Yes.
Trustee Warren.
Aye.
Trustee Ursink.
Aye.
Trustee Amenta.
Aye.
Trustee Bachhorst.
Yes.
Trustee Stokebrand.
Aye.
Motion passes 6-0.
My question then is, do we need to revisit the penalty section? I think Tammy did.
We still do, I believe. Right? Because I'm not comfortable passing this with how it's stated here.
Can you review what the motion says for section F? Jessica's original motion.
All right. You want Jessica's original motion read?
Just
right,
for
just for the penalty, yeah.
Okay. So it has change issue warning by North Shore Health Department to the village issue the warning.
So, but everything else is in there?
Yeah, that's what it's confusing.
Can I
Trustee Warren?
Can I amend that motion? Can I amend section F to say the village will provide appropriate social distancing education if feasible?
Perfect. Second.
A second by Tammy. Okay. Sarah, would you please call the roll? Is there any discussion? I don't see any hands. Please call the roll, Sarah, for the amendment, Trustee Warren's amendment.
Sorry, still writing. Hold on one second. All right. Trustee Amenta.
Oh, I'm sorry. Can you read that one more time? The village will provide what?
Appropriate social distancing information if feasible.
I mean, that's not much of a penalty.
I think it was education technically.
Education.
A step beyond self-enforcement.
I guess yes.
Trustee Bachhorst.
Yes.
Trustee Carpenter.
Yes.
Trustee Ursink.
Yes.
Trustee Stokebrand.
Aye.
Trustee Warren.
Aye.
Motion passes 6-0.
And now we're ready for the,
I have one last amendment.
Trustee Bockhorst.
I'd like to, under item B, the duration of Shorewood's, where it says existing emergency declaration order. I just want to remind everyone that if we are the body, this elected officials, okay, arbitrarily determining how long an emergency declaration order will be, is there any way we can tie this to a state or a county or something else? Nathan, sorry, I don't know if you're the person to ask on that. Or I guess it's the health, go ahead, sorry.
No, I definitely see your point. And I wish I had a better answer for you, but I don't know what existing declarations there are at the state level right now. I don't have them in front of me, but I think our local declaration is somehow tied to that, if I remember correctly.
I don't remember.
Yeah.
I thought the local was not tied to the state. The state emergency declaration has expired and the state legislature hasn't acted on it for it to be renewed. In terms of the question about, the public health elements, the issue with any kind of gating criteria for determining when the mask ordinance would expire is challenging, because as we see with the data, we're going in and out of, surging and stable. And so then you would be revisiting this again and again for a period of time as those cases ebb and flow. So that would be the concern with tying it to that type of gating criteria, which is tied to our phasing plan. So I mean, while I hear your discomfort with tying to the emergency declaration, at least it gives a long view of, okay, now we are done, or at least agreeing that we are no longer in the emergency state for the pandemic. And the health department can certainly offer the advice on when that time frame is, so the board doesn't have to arbitrarily feel that they need to make that decision.
Okay. So we,
Trustee Warren.
I mean, maybe this is just form over substance, but I mean, just to provide a little more context, should we put, I'm trying to get to what Trustee Bockhorst is implying, should we put in consultation with the North Shore Health Department or something like that? I mean, I kind of see the dynamic here. It's tough to tie it to anything, and everything changes so often that I'm just trying to put a little more structure around it. Trying to think of some way to do this.
I just want to say, like, until further notice, Shorewood's sort of that sort of a thing. And for the,
well, then we're the further notice.
Right. I mean, then we can control our own future. What's wrong? I don't understand what's wrong with that.
Yeah, I have a.
Trustee Amenta?
Yeah, I'm not clear what the objection is. I mean, this is a Shorewood ordinance, and we've declared a state of emergency, and it's tied to our own declaration. I mean, I'm not sure what is. I don't understand the objection.
Okay, so how many of you would be comfortable getting rid of an emergency declaration order if there were still one case of COVID in this area, or two? Like, what, this is then completely dependent on our comfort level. And as anything involving public safety and health, generally people will err on the extreme side. This also, like, tying it to an existing emergency declaration order, how do I say this? There are certain factors under an emergency declaration order that don't exist within, like, under a normal state. So there are additional powers and responsibilities by our village president, and also by our village manager, if I'm not mistaken. So it's just, it's a tricky thing. I mean, if there were a different, yeah, and I don't know, are you going to be the one that says, okay, everything's fine? Or do we err on the side of fear here? So I'm not being clear. I'm not that lucid right now. I'm pretty tired. But.
So do you want to just remove the part that says for the duration of Shorewood's existing emergency declaration order and begin with any person 4 years old or older who is present in the village of Shorewood? Just remove the first.
No, it's the
clause.
same thing, almost. Well, I mean, it's not exactly the same thing, but I see other people with their hands up.
Okay, Trustee Warren?
I was pointing to Trustee Carpenter. I'd like to talk about Trustee Carpenter's way before me.
Okay, Trustee Carpenter?
Thank you. Director Christensen, can you maybe clarify what phase we are in? Because I wonder, the phases for the North Shore Health Department were directly connected with cases and cases, the direction of cases. So I think to Trustee Bockhorst's point, if we are in a significantly more favorable phase, maybe that's a time that we could say, I don't remember all of the phases, I apologize. But maybe that's a parameter that we could set forth. And then also to kind of clarify on that question, are you able to move back into a previous phase?
Right, those are excellent questions. So right now we're in phase C of the plan and phase D is full opening. So I think that there's some limitations with those phases that tie us to the data and the gating criteria that I'm personally and professionally struggling with right now, as we know that some of those are yellow and green and would move us into full opening. Yet other information we have shows that we are not ready for full reopening. So my concern with tying to those gating criteria and those phases as they are currently would not be a good indicator of are wanting to relax the mask requirements. And then we will likely go back. We, in terms of the guidelines we put out there, talked about going back and forth from C and D phases, but we hadn't talked about going back to phase B, but pausing in phase C for a duration of time. So if we went to full reopening and tied this mask requirement to that phase, and we needed to go back to phase C, I don't know then if this ordinance is back in play or if we need to be back in this discussion to have another meeting for passing it again.
Could
Trustee Warren?
Could we just do it that way in terms of, could we say, if we hit phase D, this ordinance drops off, and if we rewind, then the ordinance comes back to life? Sorry, it's getting late, so I'm not as eloquent as I once was, but I mean, maybe that's the way to do it.
Well, I do not think that that's a great idea in terms of the mask requirement that you're putting out there. And what we've talked about today is the benefit of masks for prevention. So if they're making a difference and we're seeing those case numbers go down or flattening and those indicators being in yellow or green, I feel like we will prematurely take away the mask requirement before we would feel ready for it in the phase of the pandemic. I would feel ready for removing a mask requirement when there's a vaccine and we've gotten the population vaccinated against COVID. That would be a time when we're going to be, feeling more confident that this is not going to impact our population.
That could be a good place to go.
So do we want to say something like, from this date forward, every 6 months we will review, something like that, build in a 6-month review period?
I'd be more comfortable putting in a term period, and then we'd have to either reinstate the ordinance or go from there, but I don't know.
Yeah, so, a date would probably be good. We should put a date on it. I would say, let's say 6 months. I think that's a good date, right? So let's take 6 months. We'll review it 6 months. I think that's good.
January 1.
Yep.
Yeah.
So we could say until January 1, something like that.
How about January 15th? That will have given you guys the opportunity to meet for your first meeting in January.
Okay.
And kind of get past that time.
Thank you.
Okay, so I'll make a motion until January 15, 2021. Any person 4 years or older, I'll just change that first clause. Sarah?
You have to do it in both B and C.
Could I make a?
Oh, no, never mind.
No, we got rid of C.
Sorry.
Yes, Nathan?
I just wanted to make a suggestion, something along the lines of that the regulation will be evaluated in conjunction with the North Shore Health Department and to be reviewed no later than something like January 15th or whatever the date is. My only suggestion there is if there's any, if there's ever any challenges to the ordinance, that it's arbitrary in the sense that there's an arbitrary date that's not connected to the need for the mask, then we can always say, well, it says in conjunction with consultation with the health department, and then we're setting a renewal, we're setting a date for review, and that gives us a little bit more strength in terms of defending against any potential challenges where somebody might say, well, it's arbitrary or the date's arbitrary.
Nathan, is it still the same kind of strength if we say it drops off in 6 months, and then when it drops off, we review with the health department? I guess I prefer for it to have a drop and then us renew it, as opposed to it we have to go through and end it. And I prefer to sunset it and then but have the option to renew.
Yeah, I think as long as you're referencing somewhere in there that it's based upon consultation with the health department or something along those lines, I think that's fine. Yeah.
Yeah, I like the idea of just sunsetting it in 6 months, and then if we want to take it up again at that time, we can. I'm sorry, who made the amendment? Do we have an amendment yet?
We do not. We do not. Would you like to make one?
Okay, I'll amend section B to remove the first clause for the duration of Shorewood's existing emergency declaration order. And then I will amend section 3 to say this ordinance shall take effect and be enforced from, is there supposed to be a date there?
I was wondering about July 20th.
Okay, from July 20th, 2020 until January 20th, 2021.
Second.
Is that good, Nathan? Okay.
Any other discussion? We need a second. I'll second the motion. Trustee Ursink?
I seconded, but that's all right. You got it.
Sorry, can I make can I make an amendment which I hope is friendly?
Sure.
I would add at which time any extension will be reviewed with the North Shore. Any potential extension will be reviewed with the North Shore Health Department.
Yeah, that's fine.
Okay, Sarah, do you need any help with that? Trustee Bockhorst?
Yeah, one thing that, and we don't know what's going to happen with the schools or anything, but it would be nice if this would expire prior to the second semester of the schools. I guess it doesn't matter. Forget it.
Okay, so Sarah, Clerk Bruckman, are you good on this? Do you want to reread the motion, please?
Yep. So we are going to remove the first line in section B for the duration of Shorewood's existing emergency declaration. And in section 3, that this ordinance shall take effect, and put from July 20th through January 20th, 2021, at which any potential extension will be reviewed with the North Shore Health Department.
As long as July 20th has 2020 in it, right?
Yeah.
I'm sorry, didn't the village manager say it should be on the 15th? Because it should correspond with our January date, or is that not?
Oh, the 20th is just fine.
Oh,
I just
yeah.
wanted to allow time to have a first meeting in January. So the 20th is great. Thank you,
Right.
Tam.
Trustee Carpenter?
I have a couple of questions. So where did the July 20th start date come from?
I pulled it out of my hat.
Well, Nathan, don't ordinances have to be posted before they can go into effect? And what is the time that, or Sarah, what is the time that they have to be posted?
I think it's like a week and some odd days or something. It does not take effect immediately. Correct me.
Yeah,
if I'm
there's a state statute on the posting.
Yeah.
I can't remember exactly how, but that's what Sarah said is basically that's
It's like
And I had noticed, you know, that
the Tuesday after. Yeah.
and Rebecca had asked for some time, you know, she said it couldn't happen immediately. And so, yeah, if there's a more thoughtful date, I'm welcome to a Rebecca.
This is almost over, I think.
I think the 20th allows us some time to get some communication out, which I think is important. You know, one of the focuses of the board has been communication. So I think it's reasonable.
I also wanted to just point out that since you've basically removed the enforcement mechanism, there's, you know, you could just take this language and do it as a resolution, because there's no need to codify it if there's no penalty. And the other issue is if you do put it in to section 319 or any of these other sections, as I mentioned earlier, there's the catch-all at the end of each of these chapters, basically, violations and penalties. So technically, if you put it into the code there, you know, there will be the opportunity for citations to be written, but you specifically don't want that. So, you know, you can take the same language and the resolution would have the same effect, because again, if there's no enforcement provision, there's really it's not really technically necessary for it to be an ordinance, but again, that's up to the body.
Can I ask my other question?
Trustee Carpenter.
Thank you. Probably for you, Nathan. You know, I do see value in that language that says because of our emergency or what is
declaration?
Thank you. The emergency declaration. Sorry, it's way past my bedtime. What would be the benefit of us taking that out and, you know, renewing and re-looking at everything on January 15th? I'm not sure I'm understanding that.
I'm sorry. I didn't realize. I don't know the answer to that. That's a policy question, not a legal question. So
I think Trustee Bockhorst was not wanting to put that pressure on us to make the decision. You know, I think it was because then we're kind of like making that decision. It comes back to us. So I think the concept was if we could tie it to something else where it didn't look like we were making the call with that, because it could be a tough call to make, right? You know, if that expires, you know, so I'll let Trustee Bockhorst explain her reasoning with that, but that's what I got out of that. Like, we want to take that kind of pressure off of us as a board and maybe the North Shore Health Department of making that decision for us.
Yeah, I mean, I'm just struggling that we are all elected and we are making this decision for our community because we feel like it is necessary. And we, you know, I remember when we enacted the emergency order, you know, it was not something that we did lightly. And, you know, being one of 4 states in the country that has no mask mandate and having the highest transmission rate in the country, you know, I think just sort of picking this arbitrary date instead of waiting until our emergency order is over, I'm just not following the logic. I don't know if you can.
Trustee Bockhorst, do you want to
Oh, sure.
explain your reasoning?
Well, it's twofold, but one is we're not health experts, and for us to I know, and the reason we're doing this is because there is a pandemic and there is a crisis, and the details that you just outlined, Trustee Carpenter. So, but for us to determine when the end date is based on things that are beyond, you know, we don't have any metrics here. That's why it would be great if this were tied to something, if we did have statewide or federal leadership at this point, but we don't. So we're doing this from the ground up, which is the opposite of how things typically work. And we also might be the only municipality that does this. So for us, again, we're volunteer elected officials basically determining when it's safe to take masks off for people. And that's, I don't feel qualified to make that decision. That's why I think that should have sunset, and then we can determine whether or not we want to do this again. It's very difficult to remove a public health or any kind of safety thing once you've instituted it. It's, I mean, think about what that day will look like. So in 6 months from now, we might get a lot of feedback from businesses. We might have there might be a plethora of reasons that would make us either, you know, redo this or remove this. And we don't know what those are because the landscape is changing on a daily basis. But for us to be the ones that create this and then tie it to something else that we've determined, you know, as a date for an emergency order, I just don't, I see this as I don't know what the proper terminology is for this, but it's like a positive feedback loop almost. But that's wrong.
Hey, did you have another question, Jessica or Trustee Carpenter? Otherwise, I wonder if we should just vote on the amendment.
Yep, no, that was helpful. Thank you.
Okay, can we call, Sarah, could you please call the roll on the amendment? The only other thing I would ask is to Attorney Bayer's point, do we want to change this to a resolution? I would be in favor of doing that, but let's go around the table. Trustee Amenta?
Now let's keep it an ordinance.
Trustee Bockhorst?
Wait, are we voting or what are we doing right now?
I'm just going around the table to get feedback. We were, I guess we should vote on, I'm sorry, we should vote on Trustee Amenta's amendment first. Sarah, could you please call the roll?
Yeah.
Does anybody want it reread?
Trustee Bockhorst.
Yes.
Trustee Warren.
Aye.
Trustee Stokebrand.
Aye.
Trustee Ursink.
Aye.
Trustee Carpenter.
No.
Trustee Amenta.
Aye.
Motion passes 5-1.
Okay, so that brings us to the original motion, and I was just going to go around the table to see if anyone else, to Attorney Bayer's point, we could at this point make it a resolution instead of an ordinance. And so Trustee Amenta declined. Trustee Bockhorst?
I'm fine either way.
Trustee Carpenter?
No, keep it an ordinance.
Trustee Ursink?
Keep it an ordinance.
Trustee Warren?
Keep it an ordinance.
Okay, Sarah, will you please call the roll? If there's no further discussion.
A roll on what?
The ordinance.
Oh, so we're voting now on the whole ordinance?
Correct.
So here's the ordinance as amended. So it is actually, it should be ordinance 3012. Creating section 319-11.2 face covering requirements during the COVID-19 pandemic of Article 2, General Regulations of Chapter 319, Health and Sanitation of the Shorewood Municipal Code. In that ordinance, we are changing the minimum mask wearing age from 2 to 4 years old. We are changing indoor areas open to the public. We are changing outdoor requirement from less than 30 feet to less than 6 feet. We are changing issue.
Wait, I thought we removed outdoor.
Yes. We did.
Okay.
We removed section C, so we just would re-letter them.
Yep.
So C would start with mask required. Oh, we removed D also. So we just would jump to exceptions would be C, is that correct?
Right. Yeah. So hold on. So then we are changing issue warning by North Shore Health Department with the village will provide appropriate education for, if feasible, for face coverings. And then we are removing section C and D. And then under, hold on. If we remove, then the part about the family doesn't matter because we removed section C. And then we are changing under section B from July 20th to July 20th, 2020 to January 20th, 2021, at which any potential extension will be reviewed by the North Shore Health Department, crossing out for the duration of Shore's existing emergency declaration order.
Right, and that date information was under section number 3, correct?
Correct.
Okay, is Trustee Amenta?
I think the section 3 that we changed, it was with the North Shore Health Department, not by the North Shore Health Department, or in consultation with. Is that correct, yes. Trustee Warren? And then also under exceptions, number 1, we should change to persons under 4 years of age.
Trustee Bockhorst?
I guess I just had a quick question again, why we chose the 20th. I know it was an arbitrary date, but if there isn't much required of us, I don't know why we wouldn't make this effective as soon as possible.
I know that staff wanted some time, and I thought Rebecca indicated that would.
I understand that, but I'm just time for what?
Communication.
Okay, but since this is all an exercise in education at some point because there is no enforcement aspect, so I don't know what the communication piece would be around.
The board can implement the ordinance when they'd like.
So I would like to amend that then and have this effective
Monday.
The Dane County. Let's beat Dane County, or at least tie with them.
It'd be July 13th, Monday, July 13th.
I guess I have to move to amend that, your amendment or whatever.
You would be amending the date. Is there a second?
Second.
Trustee Ursink seconds it. Can we do this by unanimous consent? All in favor of changing July 20 to July 13? It appears to be unanimous consent.
No, I'm opposed.
Oh.
An ordinance has to be posted for a certain amount of time before it becomes effective.
Oh, that's right. Yeah, I think.
The village manager just said we can post it.
Then why don't you make it to whatever, both Sarah and Nathan don't know the specific date as we're sitting here right now of when it will become effective.
So at this hour, I can't remember what.
Right. So tomorrow they will figure out what that date is, and they can insert whatever date it is that legally applies.
I'm good with that.
Okay. So do we need to amend that, or by mutual consent we can agree that it'll be the date that Attorney Bayer and Clerk Bruckman determine tomorrow?
You don't actually, you don't really need to do anything. It's because it would just like any other ordinance that would get passed, it just becomes effective upon posting pursuant to the statute. So you don't have to have any special language for that. If you just wanted to take effect as soon as practicable or as soon as possible, it just will.
Okay. All right, Sarah, will you please call the roll?
Yes. Trustee Amenta.
I'm sorry, are we voting?
On the ordinance.
On the ordinance.
On the entire ordinance, and we're changing it to just effective as soon as practical.
Correct.
Okay, aye.
Trustee Warren.
Aye.
Trustee Bockhorst.
Yes.
Trustee Ursink.
Aye.
Trustee Carpenter.
Aye.
Trustee Stokebrand.
Aye.
Motion passes 6-0.
Okay.
Good job, guys. That was really great work.
Yay.
That was really good work. I mean, seriously. We came up with that. I mean, it's not perfect,
Or
but
midnight. Yay.
Do we have a motion to adjourn?
So moved.
Second.
second, third.
By unanimous consent?
Yep.
Okay, thank you.
Thank you.
Thank you,
Good job,
staff.
guys. Good work, everybody.
Thanks everyone for bearing with us.
Yeah.